Councilman Abdelaziz, Councilwoman Cotton. Think she's having some problems along, and I guess as soon as she gets on. Councilman Dabo. Councilman Dabo.
Present.
Thank you. Councilman Jackson.
Here.
Councilman Khalid.
Present, Madam Clerk.
Thank you. Councilman Mendez.
Good evening, Madam Clerk. Present.
Thank you. Councilman Mims.
Here.
Councilman Glass. Okay. Mr. President.
Present.
Thank you.
Madam Clerk, will you please read the statement of compliance?
Yes, Mr. President. Meeting covered by 48-hour notice. Notice of the time, date, location, and agenda of this meeting was transmitted to the North Jersey Herald News, the Record, the Arabic Voice, the Italian Voice, the State Council Pulse, the Dominicana News, Pescator International, El Especial, the Paterson Press, the City Post News, Tap into Paterson, in addition to any other publication duly requesting such notices. At or about 11 a.m. on December 30, 2020, such notices were posted on the bulletin board in the offices of the City Clerk at City Hall. And let's read the notice. Pursuant to the Open Public Meetings Act, be advised that the Municipal Council of the City of Paterson has scheduled a special meeting for Tuesday, January 5th, 2021 at 5:30 p.m. to be held via WebEx/Zoom or in the Council Chambers, 155 Market Street, 3rd floor, City Hall, Paterson, New Jersey, for the purpose of discussing the following matter. Public portion. Anyone who wishes to participate in the public portion, dial 973-321-1579, 973-321-1579, and enter code 8326. Press star 1 to listen to the meeting. Press star 2 to leave a recorded comment. Press star 3 to be added to the speaker list. Discussion. Item number 1, discussion between the municipal council and the health officials to provide updated information on the coronavirus COVID-19 pandemic and the measures in place to curtail the pandemic. No formal action will be taken. Mr. President, you may.
So, Madam Clerk,
Yes,
two
sir.
things.
Yes.
Let's give an opportunity, a few minutes for the public to call in.
Sure.
And at the same time, I'm going to initiate this special meeting by requesting a moment of silence to honor some of our Patersonians that we have lost. We lost Dr. Carlos Lugo, which is a member of this community, the Dominican community also, Mr. Carney P. Braggs, and Mr. Joe Clark, which is an educator.
And Ms. Ada Downing, Council President.
Thank you, Councilwoman. So let us thank and remember them in 1 minute of silence. Thank you. Madam Clerk, could you repeat the number again for the public?
Okay, for the public portion,
Yes.
one who wishes to participate in the public portion of the special meeting tonight, dial 973-321-1579, 973-321-1579, and enter code 8326, code 8326. You press star 1 if you wish to listen to the meeting, press star 2 to leave a recorded comment, and press star 3 to be added to the speaker list. So at this time, Mr. President, do you want us to handle the public portion first?
Yes.
Okay. So
Do we have any speakers?
I will just check with the IT group. Give me a second, please. Is there anyone, please? Not yet. There's no one yet, Mr. President. Maybe we should give them 2 minutes and just wait a little. Is that okay with you?
Sure.
I looked at the timing for 2 minutes. The number to dial for the public portion is 973-321-1579, enter code 8326, and you press star 3 if you wish to speak on the public portion. 973-321-1579 is the number to dial, and enter code 8326, and press star 3 if you wish to speak in the public portion, which is now open. Thank you.
Thank you. I would like to,
Mr. President, I'm gonna wait, I still have a minute and
sure.
2 seconds. So
Yeah, I just wanna, apologize to the public for not starting at 5:30. I was actually in front of my computer way before that. I was here in my office actually before 5 o'clock. Also, there was I was having technical difficulties, and also the council chambers was being used. Madam Clerk, I'm going to request, and I'm just saying this here so I don't forget,
yes, sir.
that I asked when I got the call today that the council chambers was being requested to be used.
Yes, sir.
The first question I asked if this was going to interfere at all, like if the chambers is actually being used by our IT department, and I was told no, that that it shouldn't interfere, but he actually did. So going forward, today we have a meeting. First of all, we're not supposed to have a large crowd, and the and the event that was there, they didn't have a lot of people. It was 10 people. That could have been held in another room in City Hall. We have sometimes we do it in the hallway in the second floor, or you could have done it in the mayor's office, which is pretty it's a good sized office. But yeah, we should not hold up, the business of the city, for any other purpose, any other reason.
Yes, sir, I understand.
Thank you.
You're welcome. Okay, it's 2 minutes gone, Mr. President. Let me just double check, make sure there's no one. Is there anyone for the public portion, IT? Just give me 1 second, Mr. President. No callers. There's no one for the public portion, Mr. President.
So,
Entertain a moment to close.
Seeing none, move to close.
moved by Councilwoman Mims, second by Councilman Mendez. Roll call, Madam Clerk.
1 second. And then, roll call to close the public portion for the special meeting of January 5th, 2021. Councilman Abdelaziz, not there. Councilman Daglo?
Yes.
Councilman Jackson?
Yes.
Councilman Khalid? Councilman Khalid? You have to, okay.
I said yes, Madam Clerk.
Oh, thank you, I didn't already. Councilman Mendez?
Yes, Madam Clerk.
Thank you. Councilman Mims?
Yes.
Mr. President?
Yes.
The vote is 6 in favor, 3 absent. The public portion is now closed. So, Mr. President, may I just read what the discussion is about? Can I go ahead and handle that now?
Yes, Madam Clerk.
Okay. This discussion is the discussion between the Paterson Municipal Council and the health officials to provide updated information on the coronavirus COVID-19 pandemic and the measures in place to curtail the pandemic. There will be no formal action will be taken. Mr. President, you may take over.
Yes. So, given that we have not gotten an overview and we got some information through an article, I felt we the council felt the necessity to hold this meeting, and in which we're going to have interaction with the administration and make some recommendations at the same time. So we want to hear from Dr. Paul Prasad, and we start with you, Dr. Paul. We just want to hear from you. You're muted, Dr. Paul. You're muted.
Thank you, Council President. May I ask specifically what you'd like to hear about?
Well, we want to know the status of where we how is it looking here in Paterson? What's the numbers? What are we doing as a city? What resources are in place? anything that you feel that's important for the public and the council to know regarding this pandemic and how we're handling it.
Thank you very much, Council President. Council members and members of the administration. Today, specifically, there were 96 positive cases, and that brings our total for the pandemic so far to 18,669 positive cases in the city of Paterson. Also, our deaths were updated today. The total number of deaths we have for the city as of today is 443. That was increased by about 73 deaths. The last time we reported was 370. So there's been an increase, a lot of deaths in December. So we updated the numbers today. Just did that, matter of fact. Also,
Dr. Paul, what is the trend? What is the trend? Is it increasing? Is it decreasing? What are we seeing out there?
well, Council President, as you know, I think we're in the second wave here, and during the first wave, after the first wave, some months back, our numbers came down significantly. Our positives came down, but suddenly as this next wave hit sometime around November or so, the numbers started to climb again, skyrocketed. We hit new highs. In the month of December, there were new highs that we hit in terms of cases, and our death, the number of deaths also increased during this period of time. When we were
Continue. I just muted the councilwoman. She just came in.
Yes. Obviously, after the first wave, there was a period of time when our curve was flat, very flat, and the death rates also, the deaths also stabilized. That time there were very, very few deaths actually. But when the second wave hit, obviously the deaths increased.
So, Dr. Paul.
Yes.
Dr. Paul. So yeah, we're gonna have this. We're gonna have some interaction, and then the rest of the council is gonna, ask questions. So, you as the health officer, what is your recommendation? Do we need more testing or less testing? I know at one time you were doing, how many days a week you were doing?
Councilman, I was just going to report on that. We were doing 6 days per week, Monday to Saturday, up to the end of the year. And we did, so far for this year, we did 1 day, January. We started testing October 5th. From October 5th to the 2nd of January, when we last tested, we did approximately 9,416 tests, and of those 9,416 tests, those tests yielded a positive number of 1,106. So if you do the percentage, you're like by what, 12%? Or of the tests that we do are actually positive tests. So we actually test those that are most needed the test. We do not do repeated testing. We test people who are actually symptomatic and who are actually not non-symptomatic. Those who are exposed after X amount of days, we test them. We do not do repeated testing, so we test them those that are actually really needed tests are the ones that get tests from us.
Dr. Prasad, but you're the health expert here, but I do hear that the people that are asymptomatic, those are the ones that tend to spread it because they don't know they have it. So if someone doesn't have any symptoms and want to get tested, I don't know if that, again, we're going to have difference of opinion on that, but what do you feel about that?
So the labs in New Jersey were very much overwhelmed, Council President, and we do test people. We do test people, not only people who are symptomatic. We test people who are exposed. One of the issues that we were facing, and everyone is facing this, is that if you don't go by the guidelines, you would end up over testing. So someone is exposed today to someone who tested positive, and they want to test the same day or the next day, and the test results comes back negative, and that person thinks, oh, I'm negative, so I don't need to take any more precautions. That person gets out and mixes with the general population or mixes with your friends, and then 5 days later, when symptoms start to show up, or 7 days later, when symptoms start to show up, they realize, hey, but I tested negative. The problem is that they were testing too early, so the right time to test is about 5 to 7 days after exposure.
So, Dr. Paul, my question, hold on, he still haven't addressed my question. So, given that we're in the second wave,
Yeah.
what do you recommend? How many days a week do you recommend that we test?
We as the Paterson Division of Health, or are you talking as a city? As a city, and I would say this.
Dr. Paul, we have a lot of testing sites in the city.
Right.
I'm talking about the benefit of what you're doing, the testing that is being performed by the city.
Okay. So, Council President, the benefit of testing done by the city cannot be overstated. We must say that, and that's one of the reasons why I read out our statistics there to you. More testing is definitely needed. I cannot say that I don't know how many times I can say that. Testing is needed. There are
Dr. Paul,
fundamental areas.
Dr. Paul, I understand, we all understand that testing is needed.
Yes.
We read an article stating that the testing was cut to 2 days. I'm asking you as the health officer,
Yes.
do you believe it will be beneficial, or is it in the best interest of the community for us to have more than 2 days testing from our health department? And the reason I'm bringing this up is we have other entities performing this test in some of the sites, and the public perception is that these companies are city ran, and they're not. Right? The tests take too long for people to receive. I've been to pharmacies that give you your results the next day, and also I've gotten it done at the county, give it to you the next day. But we need to address the way we're doing things here in the city. So how many days do you think we should do it at the city?
Council President, if I have my way, I would say 7 days per week. I actually, when I designed the program, I wanted to do 7 days per week, but I realized we have to take a rest for 1 day. The more tests we can have, the better. So if that question you asked me, how many days I think we should test, I think we should test every day.
All right, we'll discuss that later on then.
Yeah.
That's enough, I guess, from Councilman David and then Councilman Mendez.
So there's definitely a few things that I want to, when I hear numbers, oh, we're in the second wave, and you start talking about, well, we started testing in October, and we had already discussed that a second wave was coming. The reality is that we weren't doing what we should have done, which was testing earlier, so that way we could know, because I, for one, know that our numbers were way higher, and we were not doing enough testing. So the fact that now that the amount of testing that we've done, and it has shown that there are quite a large amount of positive cases, all of a sudden now the city decides, without having a conversation with the council, at least, the administration, to sit down and say, listen, we're planning to do this, and ask us when we are the people that the community reach out to. You should see my inboxes, my messengers, texts, oh my God, I'm not feeling well, or I was exposed to someone, and so for the city to have taken that measure to shut down without having a conversation, that in itself I think was incorrect. Can I say that was done through Dr. Prasad? No, because I don't think he was the responsible person. I mean, I'm hearing him say now that if it was up to him, we would be testing every day. I wish this would have started when this whole thing started back in March. The second thing that I wanted to mention was in terms of what you stated, one was the other was the contact tracing, it's really interesting that I hear, people being exposed and we don't test everybody and the symptomatic people and it's interesting that somebody that has been exposed and somebody puts it out there, right? We're not doing a good job, and I don't care what anybody says to me. I experienced it myself. 5 days later to get a call from the Board of Health to tell me, oh, you've been exposed, and when I question and I ask who, just to know, because I should know if somebody's putting my name out there, that it should be told who you said that they exposed me, and that was not shared with me, and the person did, I wanted to make sure that it was the same person. It took them 4 days to give me a phone call to say, you've been exposed. So, I could just imagine, and we're doing such a better job now, and it took them 4 days. And then after that, and I'm not gonna take this meeting to do that, but to have, somebody from the Board of Health Department exposed that I had it before I even knew about it, that was a disgrace. But that will leave for another conversation. So I just wanted
Yes,
to
please.
those two things, Council President, because I really don't think in terms of contact tracing, okay? I know plenty of people that have been exposed that actually are positive, and no one has given them a call.
Councilman Mendes.
Thank you, Council President. Dr. Prasad, good evening. Before I ask my first question to Dr. Parul Prasad, as you all know, I was very vocal about my insatisfaction about the survey that is being provided with the private entity that has been running by the East Side and Kennedy, because I received an incredible amount of phone calls from Patersonian that used those site, and a week later, one lady specifically, she went back to the site a week after, and because she never received a phone call, and that's when the person told her, "Oh, you tested positive," and I got more texts and more complaint about those entities. Dr. Prasad, have you received some of those complaints, or are you aware about that?
You asking for specific complaints about some sites or general complaints, Councilman? We've received many complaints. We get complaints every day, but not apart from complaints. More people calling us to check for the results, only to realize that we have not.
Dr. Prasad.
Yeah.
I think his question was directed at the other entities that was brought to the city at the beginning. We all had issues in the whole process, the process that were brought in. So what we wanted, the question is, have you heard any complaints pertaining to those places that are performing tests in the schools?
Yes, in schools, okay, yes, we've had complaints.
So, Councilman Mendes, you want to continue? You still have the floor, but
Let me just continue to the next question, Dr.
Yes.
Prasad, because I'm trying to understand what has been going on here. So, and it's not that, and I asked you this question to see if you're receiving the same information that I'm receiving, that some of us as an elected official are getting from the community, that we're not getting, that those entities, they're not providing the service that they should provide to the community. So I got a ton of complaint now. When you say that so the administration is going to stop, the department from testing from 6 days to 2, what do they base that decision on? Because that's what I'm trying to understand right here. And first of all, the next question that I have for you is that why is not the health department that is overseeing those entities? I mean, with all the respect, I know that that's under our chief, McDermott, and I have such incredible amount of respect for our chief. We all agree that we have one of the best fire department, not only in the state, but in the country. But I think that the health department, it should be the entity that oversees all private entities that are doing testing here. My only concern is this, Dr. Prasad. We have a lot of entities that are coming into Paterson. They're making an incredible amount of money from our Pattersonian because they're here, and they're not providing the service that they should provide. Now, in your case, let me be clear on this. As you know, I've been following, the health department when they went to Brilliant Avenue, River Street, Madison Avenue, and I see testing all the way until 9 o'clock, around 9 o'clock, and I see an incredible amount of people getting tested by the health department. Now, I'm very concerned about this decision going from 6 days to 2. So I need to know how the decision was made. I know we're getting a lot more positive cases. So we need definitely to understand, because this is serious what we're talking about here. And my perception is, with this decision, we're gonna force our Pattersonian to go to those private entities. So what is what we try to do here? So that's my question. I'm trying to understand what's going on with the situation.
So, Councilman, the funding for testing was provided by the CARES Act. CARES Act ended on the 31st, and so because of lack of funding, or that's the reason why testing was reduced from 6 days per week to 2 days, because there was no more funding for testing. Now there was no more CARES Act funding for testing, so that would be the reason. If, and that's to the best of my knowledge, I guess the administration would be in a better position to elaborate more on that. But all I was told is that, because of the funding issue.
Madam Mayor?
Sure, happy to jump in here. Thank you, Council and Council President. Yes, I know Dr. Paul, and we have had numerous conversations about this. It's something that we do appreciate the work of his department, his division. The mobile unit has been serving the city well. We are also have to live in the reality that we're faced with. And I do wish that there was more funding that allowed us to continue exactly as we did. I think part of this is a timing issue as well. We need to close the books on 1 year, evaluate where we stand, and see if we could ramp up again. This is something that I mentioned at the last council meeting. It's also the exact same time that we're ramping up vaccinations for 6 days a week. It's also the same time that we're continuing contact tracing as much as we have been. A lot of this is the same staff doing all of these things. And while I understand, I absolutely wish that we could be doing 6 days a week of testing, 6 days a week of vaccinations, contact tracing the exact way it's been done. The reality is we have to evaluate how much we can do. And we're going to make adjustments accordingly. I hope that we're going to be able to say in a few days, in a week, that we can go up to another 3 days once we sort out how the staffing is going to work and how much money we're going to be able to dedicate to this.
So Madam VA, real quick.
Mm-hmm.
This analysis is all about planning, right?
Mm-hmm.
You have actually created, I would say, a surplus, because a lot of the salary of the staff that we budgeted for is being reimbursed by the CARES Act, right?
A portion, correct.
A portion, but whatever. A dollar is a dollar, right?
Correct.
That's that. So you could have planned this ahead of time.
Well, that's what we did, Council President. So that's why we did, early on in the pandemic, we decided to use a chunk of the money for redeployed, so that for the first quarter, especially the first quarter, because we knew it would continue through there, but mostly for the half the year, we would have about $3 million that we would be able to use for COVID-related costs. But that's not just testing. It's also the overtime of firefighters who are sick with COVID and we have to backfill.
Okay.
It's also, vaccination overtime costs, which right now, it's 1 day a week that we're gonna have overtime.
So let me continue. So, didn't you stated in a previous meeting that we're able to bill 75% of any costs associated with COVID?
with FEMA public safety overtime. It's a very specific category, so,
Okay, but
so our.
that's the bulk.
True, but as of right now, we haven't seen any of that. So we also have to, at the same time we're talking about expenses, we're also talking about cash flow. So we know that right now, we're hoping that, we're gonna be able to get those FEMA numbers back in. But we're also looking at where we stand right now.
Also, didn't Dr. Prasad, didn't you order a mobile unit?
Yes, we ordered a mobile unit.
So when are you gonna get that?
I don't know the exact date, but it's in the process. It's in the process.
So let me ask you a question. Do we have one now?
We have one for the HIV for HIV services. We borrowed it. It's an older mobile unit. But we borrowed it. So
How much did we pay for that?
I don't know the exact cost.
Well, it's in a few hundred thousand, right?
Yes, a few $100,000. Yeah.
I think it was like 300 or 400 that we paid. So we cut it down to 2 days. So I'm questioning, by the time you get this mobile unit, hopefully we don't have to use it, right?
Well, we will,
Hopefully.
because we'll use it for vaccinations also. That's part of the plan.
Yeah, I'll leave it at that. I'm gonna go in this following order. We have Councilman Jackson, Shaheen Khalik, Abdelaziz, and Councilwoman Mims. You have the floor, Councilman Jackson.
Thank you, Council President. So, a couple things, before I bring my line of questioning to, Dr. Passard. I just wanted to clarify earlier, Councilwoman Davila said she received a call from the Board of Health. And she doesn't have to do it now. I know she's probably stepped away, but I'm hoping, Council President, we can have her clarify who exactly that was that made contact with her from the Board of Health. Because as you know, we've pointed out in the past, this is actually the Board of Health. And the fact that the board has been absent in its responsibility and oversight is part of the reason why we are where we are. So with that being said, Dr. Passard, I have to ask you, in the sequence of events where there's a potential liability and or vulnerability to the public from the pandemic, who is ultimately responsible for the health, the overall general health of the community?
Well, that's not an easy question for me to answer, Councilman. Healthcare in this country is divided both into public health on one side and also private health. Obviously, people's doctors are ultimately responsible for their health. But when it comes to public health, and public health, by public health I mean population health at a population level, it's the health department, the health officer is responsible for the health department, and I guess therein lies the answer to your question. So when it comes to public health, now we are not responsible for individual people's health. That people have doctors, they go to the doctor. That's an individual. Public health addresses health at a population level, and that's why we address issues that affect population. Communicable disease, an infectious disease like this pandemic, like any communicable disease or any infectious disease, is one of the most important functions of a public health department is to address public health issues such as communicable disease, like this one that we
So like this one here. So in the event that there's a rampant uptick of infections, or should I say, a rampant uptick in the spread of this communicable disease, is there a person or a specific group of people within the city that's ultimately tasked with making sure that the at-large public health to reduce the spread, to ensure that the public in general is safe? Who do we point that finger at?
Control and taking measures of control against communicable disease or infectious disease lies within the scope of the health department.
Health department. And that there would be a licensed medical professional within that department, right?
The health officer is the licensed public health professional by the state, but in addition to the health officer, there are a number of other people that are licensed, that work here as a team, and that's why most of our staff operating out of the health department are licensed professionals in various areas. They all fall under my supervision.
So I'm just trying to make sure I understand clearly. So there's multiple licensed medical professionals that take part in this decision process?
Well, the decision is left to the health officer. I'm in charge of the operations of the health department, but I rely on my other personnel, for example, licensed nurses, licensed environmental health specialists. We all function as a team, and I lead that team. So there are a number of people who are in charge. We have communicable disease nurses, for example. Lead inspectors, that's another area. Most of these areas in public health, we have personnel that are licensed.
But Dr. Bashar,
Yes.
I want to stay dialed in because I'm sure that the council president is going to try to wants to keep the meeting, in a certain time frame. So I want to stay dialed in.
Yes.
So we clear that there's a group of licensed professionals that all function under your purview,
Yeah.
and ultimately you're the health officer that's in charge of this decision. So I'm curious as to when it comes down to a decision. Earlier, I overheard you say that if it was your recommendation, you would like to have testing 7 days per week. So how is it possible that? And I'm trying to understand exactly where this decision was made and what licensed professionals, medical professionals, took part in making this decision. Because quite frankly, the way that I understand, and I could be wrong, so I'm here to be educated if necessary as well, but there should be a recommendation made by your division, your department, which is overseen by you, to the Board of Health, which is this body here. So how is it possible that a decision was made to reduce testing, to increase the vaccinations without, why would you make a decision that way to reduce testing from 6 days to 2 days a week?
Councilman Jackson, I did not say that I made that decision. I just stated that the rationale for the decision was because of funding. That was not a decision that was made by me. As I stated multiple times, if it's up to me, I would test, I would vaccinate, I would do contact tracing every day because we're in a pandemic and these things are very, very important. These are some of the tools that we have.
Let me make this last point before my next question. In the event there was an uptick of infections or contaminations, and we have if the general public, as a point of placing liability, was to turn back and say, well, what the city did not render the support necessary or that was adequate, and I'm trying to understand, you're saying you did not make the decision that you're ultimately responsible for. We're talking about public health, general public health. Then how is it that you're not the person that's making that decision? And furthermore, who's the person? How do we have non-professionals, non-trained professionals making a decision that is detrimental to the health of the overall population without any answer and quite honestly without any pushback from you? Because if you're ultimately accountable and responsible for this, then I'm trying to understand, and I hear, because relative to Councilman Mendez's point a moment ago, we have third-party agencies, and I do recall Dr. Passard because there was a very big push in the beginning for you to oversee the testing, and it was not allowed for some reason, once again, and that's part of the reason why I pushed for the council to take its rightful place as the Board of Health and making those instrumental decisions and hearing from you directly. So you weren't able to do so. Then when you finally were, we saw the outstanding job that you and your staff has done. So here we are once again with someone else, a non-trained professional in an area where there's a detriment to the community, and you, as the public health officer, are not in a position to make that decision. So very quickly, because I don't want this to drag on. I think we kind of got to the context of it. Where does that leave you as the health professional relative to your concern of the public's general health?
Well, Councilman Jackson, there is testing going on in the city. There's a lot of testing going on in the city. Now, is there need for more testing? Oh, yes. I would always say that there's more need for testing, but there's testing going on in the city. But I work for an administration, and I have to, as I stated numerous times, I would recommend testing every day. If it's up to me, and if I have the resources, I would do testing every day. Obviously, I cannot work outside of the scope of the administration that I work for. I have to, I cannot proceed and do tests because I'm told there's no funding. So.
So, Council President, one last thing.
Yeah.
If the fire chief was to deem a hazard for a specific location, there's no one that can override the fire chief. He ultimately has, the authority to make a decision on whether or not a fire is in need of being taken care of. So goes to say for the chief of police, if the chief of police has to make a decision on public safety, no one can stand forward and override the chief's decision. The same goes for, various, if the building subcode official comes forward and says, this building is an imminent hazard, it has to come down. No one can stand forward and get in the way of that decision. Here we are listening to the health professional, the medical, licensed healthcare professional who's telling us what we need to have. And, what I would like for you to delve into, Council President, at some point tonight, because we all understood where, and maybe being in the finance chair, you probably have more information on this than I do, but we had $38 million that was said to be expended relative to COVID. So where are we with those lists of expenditures? I've asked over and over again, let's have a list, a full financial disclosure on what exactly we spent this money on. When we have, officers who've been paid in excess of $7,000, $8,000, $9,000 per pay period to fog facilities, and we have various members. And one last thing I want to point out, Council President, because I think Dr. Prasad, I would like for you to answer this. This is a travesty, because a large percentage of our employee base have been denied the opportunity to receive hazardous pay, even when it's been in their contract. This administration has chose not to pay the employees that we're actually forcing to come to work. Now, to your point, Council President, a moment ago, we're recouping the money because a large majority, I know that the health director went out to hire specific employees with specific talents, licensed nurses, to conduct testing on these sites, but the large majority of these people who are working on these sites are city employees, and they're being paid their normal salary that we budgeted for. So if you have in excess of $38 million, even if you just made sure that you circumvented and added in a small amount for the hazardous pay to these employees. How are these employees? They're on the front line. They're on the front line conducting testing, which they can easily be exposed. In fact, one of the young ladies was actually attacked by a resident, and she had to defend herself and actually fight someone. And how is that not validated as being hazardous? You know, a young lady was actually, physically beat up and had to defend herself, and these employees are not even getting hazardous pay. This is it's a travesty. You know, just the lack of respect for those city employees who are putting their lives on the line, who are, at the very least, coming to work and making sure that these small day-to-day functions continue so the public can be taken care of. Where is the answer to this, Council President? One, where are we with the expenditures of the $38 million? Why? And we all were told that once we expend $38 million, we will be entitled to more. And why haven't we done so? Where are we at with the expenditures, and why aren't employees being paid hazardous pay when they're being paid from the regular administrative budgeted account?
So we're gonna ask that question later. I have some notes here, so we get a status on billing and collection, expenditures. Well, you should have that information, Madam BA. If you don't have it in front of you, actually you're in your computer, so you might have that information in front of you. But before we continue with the next speaker, which is Shaheen Khalik, Councilman Shaheen Khalik, I want to ask Dr. Paul. And Dr. Paul, the answer is just a yes or no, please. Did the administration consult with you or get any input from you before they decided to cut it down to 2 days?
I made my recommendation. Yes.
Yes, Council President, I can answer that as well. We did talk with Dr. Paul.
Okay, you talked to Dr. Paul, but my question is, do you ask for his
You asked
input?
if we consulted with him.
And the reason is, you could have a smirk, but the thing is that the experience that we had with this administration during this whole pandemic has been that all the decisions were being made by the administration, similar to what Councilman Jackson said. He stated in meetings, many meetings, right? You guys decided to go out and bring these companies in, which was a disaster, right? I don't want to bring back bad memories, but it was bad, right? To this day, you guys were trying to present to us to pay one of these companies a ridiculous amount of money, and they never came back to us. Now they decide to bill at a lower rate, bill the CARES Act at a lower rate. So the question that I'm asking is for a reason, because we want this administration to be more inclusive of their professionals. All the decisions, we cannot micromanage. Every decision have to be calculated, and you have to be made based on facts, right? So that's why I asked the question. It was not, I just want to make sure that Dr. Paul was involved in the conversation before the administration made the decision. Councilman Khalik, you do have the floor, then Councilman Telesis, Councilwoman Mims. You have Councilwoman Cotton, and then Mendes.
Thank you, Council President. Let me do some credit to our health officer and the whole health department.
There's a big echo, Councilman.
Can you hear me now?
I think there's a big echo. I don't know if it's your internet, but
Can you hear me now?
that's much better. You're closer to the mic. Yep.
Okay. Let me some credit to our health officer and the whole department.
He went back again. Get closer again, Councilman.
Can you hear me now?
Perfect.
Okay. I just want to give some credit to our health officer and the whole department, director and the whole department. This is an unprecedented event going on. Nobody was prepared for what's going on. Now, they got another test of vaccination. Did we hire more people to vaccinate to give out the vaccine? And another thing, the health department had those testing from 2 days. It does not mean that Paterson resident cannot go out there and test 6 days a week. What I have learned, I went to a place in South Paterson, chief of police.
Councilman,
6 days a week.
Councilman, you're getting caught off. Do you wanna check your internet, maybe let someone else,
Yeah, let's see you later.
Alright. So, Councilman Delacis.
Thank you, Council President. I'm going to be very brief. So, I think most of us are, I'm not going to speak for anyone, but I think most of us agree with our director, that our public health officer, that we do want testing, we want testing every day. I, for one, am a proponent of testing. I think the more testing, the better. And I have a few questions for the administration. I know that the Congress passed the second round of CARES Act, and specifically in that second round was, I think, $25 billion for testing. Has that money been allocated down to the municipalities and the counties? And is committed, because there's a simple thing here, is a funding issue, right? We're looking at the director and the Paterson Health Department has done a great job with testing, and no one argues, right? I would want testing every day also. I agree with the director, but the funding, right? So how do we get that? How do we get there to pay for the services? Because it's not for free, it's not volunteer. We have to pay people. So how can we? Is it the second round of the CARES Act, Madam BA, or I don't know if the director could answer this, has that trickled down to us for testing?
No, so are you speaking about the bill that was signed on December 28th?
Yes.
We don't have any indication yet of how some of that money is going to be given. Some of it might come through HUD, so similar to the CDBG format. The CDBG COVID has already had a couple rounds, and we're actually likely going to get a second round of Passaic County CDBG that wasn't kind of CARE specific, that didn't have the same deadline. And so though that is coming in, we're going to be getting some of that for testing. That's one of the reasons why we're continuing with what we're doing, because we know there's going to be a little funding that's going to come to supplement. And then hopefully once we have that in hand, we'll be able to ramp it up. I'm hopeful that we'll get some details. Maybe it'll go directly through the states. We don't know at this point.
And because I'm looking at the bill here, and it's $349 billion, and specifically the $25 billion is for testing, right? So I would recommend that we reach out to the county in a written component, right, and say we would like this much money to continue our testing program, right? Have they said no to us?
The thing about this round of funding, there's no further direct aid to states or to counties in the same way that it was before. So the testing might come like in a specific format. It's unlikely to go in the same way it was before, like our CARES allocation. So it might be the Department of Health, it might come through the State Department of Health, it might come as a HUD allocation. Well, we're gonna have to wait and see.
Wherever,
Yeah.
and I think what I'm saying is put a request to the state, to someone, say Paterson would like to continue its testing program, and this is the money we need, right? Because at the end of the day, we're gonna have to find money, either in our local budget or from federal funding. And I think there should be a request from the mayor and the administration to these entities. If it's a county funding agency, if it's a state funding agency, what I've learned, you don't receive if you don't ask.
Agreed.
So I think that's my big thing here is there is money. I feel that if we do look around, I do agree we do need more testing, right? I know the vaccinations are important, but if you read of what's going on, there's more people getting tested than people getting vaccinated. So it's like, it's a supply and demand. Where's your supply? And testing right now, if you look at the numbers, and this is nationwide, we haven't done a good job vaccinating people, not just in the city of Paterson, not in the state of New Jersey, the entire country. But we are testing people. I drive around, and in my ward, we're fortunate in the 6th ward, we have many places that have testing centers. And I see it. When the city is there, there's a line. When I go to Pharmacy Plus on 900 Main Street, there's a line. When you go to Shifa Pharmacy on Main Street, there's a line. We have 4 or 5 in the 6th Ward. St. Joe's covers the People's Park section on 11 Getty Avenue. South Paterson has 4 locations for testing. So I see the need just driving around my ward. So I agree with the director that the testing and my colleagues is there. I do want to just state, with anything in life, and I think as council members we hear this, you're going to get complaints, right? And I don't think everyone's perfect. Every agency I just mentioned, I've heard a complaint about, right? The testing wasn't good, they were rude, I didn't get my results, I waited too long, the county I heard complaints about. I think that's the nature. We are in a pandemic, and we need to rectify those situations. So, to Madam BA and the administration, like I said, in the 6th Ward, we do have many testing centers, private and the city and nonprofit, St. Joseph's. And every time I think, if you ask my council colleagues, you drive around, I've never seen no line. Never. The entire, and now more than ever, I saw about 60 people before I came back home from work on Main Street. So I commend the private entities in my ward, and I commend the Paterson Health Department. So Madam BA, we really have to look for these funding sources, especially with the second round. We should reach out. And also, Madam BA, the state has gone into some of these cities. The state come into some of these cities and assisted on testing.
And we can have maybe, Councilman, if we can have Director Castillo talk a little bit about that, because we do have the state present here in Paterson, and she also has some information about the testing sites too, and the numbers that we've been seeing here. So you're right.
So Councilman Abdelaziz, before we go to the director, let me ask you one quick question. This administration brought in those testing sites that are in the schools right now. Am I correct?
Correct. Or that we have an agreement with, yes.
Yes, the agreement, you brought them in.
Yes.
With that agreement. Who's monitoring them? Who's evaluating them to make sure that they're doing a good job? Because Councilman Abdelaziz and I often have conversations of how some of these places in the 6th Ward and other places are efficient, like the county. You get your test done, you probably get it within a day, maybe 2. Mm-hmm. They have an app, right? Where you get your results yourself, or maybe you get an email, and it doesn't fail.
I do know Chief McDermott is on, and I don't know if he's still there, but he's the one who's been working with those sites. And he was on the council meeting last week, he said he was gonna touch base with them, and I know he has, I don't know if
the problem is that they have been failing us since the beginning. They've been failing us since the beginning.
Councilman, I don't know if that's exactly right. I think these sites have been doing a really good job. Like Councilman Abdelaziz said, there are always going to be occasional complaints. The biggest challenge that they have said to us is when their team has called to give people results or tried to reach out, and they never got a call back, never got a response back. And so, and I can let Director Castillo speak to this too. I know you.
Hold on a minute. But that's the problem. Why are we making phone calls? Why can't people just? I've been to places you download an app or you register with them and they send you an email.
Because that company is an urgent care.
What was that?
So, like the Vault is the company that does things like that. The partners we're working with, they're urgent cares, they're doctors that have scaled up their testing in order to work with the community. So obviously the technology may not necessarily, it's something they would have to invest in.
Thank you for the explanation, but it still doesn't justify it, right?
Oh, but they're still able to get the information out.
They're not, because listen, and I'm not passing a negative comment for our health department, but my personal experience, I went there one time. It took more than 5 days, and I happened to mention it in a city council meeting, that it's been 5 days and I didn't get my results. I get a phone call next day.
Right, so but I think that's a good example that there's always going to be some.
But
that was our health department. That wasn't one of the urgent care centers.
Councilman Abdelaziz, you still have the floor. I apologize. Let me ask you a question. The pharmacy where we get tested, why is it that we get an email from them right away in South Paterson?
Council President, I can't answer to what these private entities do. That's their.
We need to remove them. We need to remove them if they're not working out. If they're not providing. that services for our residents, we need to remove them.
Now, Council President, I just want to conclude, I want to on the record, I don't, when my constituents reach out to me about testing, I don't send them to, I don't recommend the sites at Kennedy or East Side. I recommend them through the city or through the ones in the 6th Ward. I just want the administration, I don't want them to think that I've never received complaints, my constituents don't really go here. But, Council President, I agree with you, and Madam BA, and this is what we're asking, I guess, administration. The entities that I have in my ward, they're private, they don't answer the city, there is no partnership, it's a business, they do it. And maybe that's why it's running efficiently, because they want to make sure the business is good, right, Council?
Correct.
But when we partner with someone, right, like we stated, and you just heard from 4 or 5 council members that there have been some issues there. Once you partner with someone, we're attached to them at the hip. So that's we gotta be responsible for that. So we either tell them, enhance your service to meet the needs of our residents, or we will partner with you and then the agreement falls. I think that's what the council president say. And we gotta understand, realistically, you're gonna have some complaints. That's everything, right? I will be lying to you right now if I did not receive a complaint about every single testing site that I named. Every single one. And then you answer their question, they get it and say, but that's just the nature that we're in, the business that we're in. Well, to conclude, Council President, Madam BA, if we gotta scrape for those dollars, we gotta claw those dollars from wherever we can. Right now, the demand is testing. So if we're going top heavy on one side, maybe we shift as we go. Right now, the general public can't get vaccinated, right? And maybe we switch it once we go from there. That's what I conclude. 6th Ward residents, they have them, not just 6th Ward, City of Paterson. There's many testing locations in South Paterson, Curamed on Crooks Avenue, even in Clifton. The Lakeview section goes to the one in Clifton on Crooks Avenue, and you even got St. Joe's. And I want to hopefully continue the city one day a week in my ward, because they've been doing a great job. Thank you, Council President.
Nicely put. Yes.
If I know Chief McDermott is on, and he can just speak to a couple of those points about just the oversight and kind of making sure that the testing site knows that they do need to serve our residents really well. I think that is important, and we are doing that. I want to make sure everyone knows.
And we do want to hear, but the issue that I have personally is that from the beginning, even the ones that were working here, like that we didn't renew their contract or we were asking for contracts, the ones where we were paying, they have not been one of those sites. And maybe you want to say I'm being too critical, but I'm basing it on previous meetings that we had. When you have one of those entities that have to call you to give you a result, I don't think that's the most efficient way to do it. They might test thousands of people in a week. You might be at work when they call you. You might not recognize the number, right? We need them to send emails or have an app or something. They need to improve their services. I've been to both. I've tried different ones, and they need to improve. That's all I gotta say. Council, Chief. Yes, this Chief, but the thing is, we need to act. We can't just leave them, let them continue to perform this test the way they're doing it. It's unacceptable. Chief?
I'm here.
Chief, you might have missed some of the... Yeah, we can hear you.
So, Chief, the question was, what's the turnaround time to get test results? Test results. We already had this discussion before. Some council members complained that it was taking 4 or 5 days for people to get the tests when other places are getting them sooner. So what's going on with this?
Yeah, so I can tell you there was 2 businesses, and I had an interview with Jonah Karlovac, the manager, personally, person to person. I did receive information which I passed on. There's fundamental issues. Number one, on their part, there's 2 labs that they're using. It's LabCorp and I forget the name of the other one, but they just fired them. So they have a contract with the labs that they have to have a turnaround of every positive, negative test within 72 hours. The one company did not hold up to it, and I know think it was TrackMed or something. Dr. Paul knows the concerns with the lab company. They've since been fired. Aside from that, on other issues, everybody is given a card at the site. There is a portal that they can log on to. There's instructions in English and Spanish that they can log on to the portal so that they can access the site and get the results. It's there. I have the paperwork. I forwarded it to the VA, and I had some members go to the sites, and they had the business cards with the instructions on them there, and they got another copy. Some of the other things that they're getting are people have phones that are burner phones or throwaway phones, and they call, and the lines are disconnected. Maybe they ran out of minutes, and the phone is done. And aside from that, they've been going actually out physically to addresses to try and identify people to get them their positive tests, because they'll give fake phone numbers. We had that on quite a few instances early on where people were not giving the right phone numbers. We don't know why. We don't know why they were doing it. I guess they figured they'd give the fraudulent number or whatever, and then go find the results out for themselves. But when you get these companies that are doing so many tests, it's tough to track people down. Or if you try and call instead of look at the portal or set up the portal, then it's tough getting through to them.
Chief, quick question. Chief, question. When did they decide to change labs? How recent that they made that decision?
It was literally just the other day when I believe they had no idea that this lab was not holding up to its end. I talked to Dr. Paul, and I said, Dr. Paul, do you have any issues with anybody there? We chatted, and he could verify here. We talked about it the other day. He said, no, the one place they're going to, we have a problem with it.
Chief.
I called up Jonah. They were fired that day.
So, Chief, you're taking action, but that's my point. We had this discussion early in the year, when maybe it was around, I don't know if it was spring or summertime. We were having the same discussion about the delay of people receiving the tests. And it's still happening. But then I go to other places, and they have the results right away. So there's an issue. And that's why we told the administration that the process should have been better when it was first done initially. We don't have that problem at the testing site at the county, and I think they use a company for this. So why is it that our residents can't get the same benefit? They're getting it through the county, but if we're providing them if we're spending resources to have, or we utilize an agreement for them to utilize, government-owned buildings, then we should have the best service possible for our residents.
And we won't know who the best one for the residents is until we get out there and try it.
Well, we have to. We go ask. We go ask.
None of us have been through a pandemic.
No, but we go ask, Chief. We go ask. Other people are using. We go ask. We don't have to find out for ourselves at the beginning. Yes, the beginning stages, but not this far into the game.
We've used a couple of different companies. We've tested thousands of people. There's going to be issues and complaints, and I talked to other people outside of here, and they get the exact same types of complaints.
Well, I gave you some example of entities that are performing this test. Let's find out which that's not even our job to find out. But maybe we could recommend to them to use those labs. Those labs are turning around quickly.
Well, I can tell you this, as stated earlier, I am certainly beyond my job description with this.
So, Dr. Paul, and that's what I wanted to hear, Chief. Dr. Paul.
But what I did do was I got this done. Nobody else was doing it. I got the testing for the city, and then Dr. Paul came in and is doing a really, really, really great job with his people. But there was no testing, so I can say what I would say is, as a fire chief, I think I did really good.
Okay, so as a fire chief, you stated that's not your job description. So I don't know how Dr. Paul was not more involved, and we said this at the beginning, more involved with choosing all these companies. He was never consulted at one point. So I put that on the administration. But you know what? Let me let Councilwoman Min. She's been waiting for a while patiently. She's up next, and then Councilwoman Cotton, and then Mendes, and then Jackson.
Thanks, Council President. And so, there's been some great dialogue on tonight from all of the council members. And we get to this point where, for months, that we've been asking, demanding, requesting, and almost being disrespected because we've asked for things for a long time, and now we're at this juncture. So I just want to go back to some numbers. So we got $8.5 million, the first round of COVID CARES dollars, which we say we spent. Then the second round, we got $5.2 million. So in total, we got $13.7 million. Out of that $13.7 million, we gave $3.8 million to the school district because we felt there were need. They needed Vithium boards and so many other things. So we gave them 3.8. So technically, the city got $9.9 million. So I'm putting that on the record. Dr. Prasad just quoted, we have 18,669 positive COVID tests for the city of Paterson and 443 deaths out of this number of positive. When we first started, we had many issues. We didn't have any testing sites, and I remember that was a conversation amongst this council. I even wrote an op-ed about testing sites, where art thou? And finally, some got in place, and we were moving. We still had some issues and some concerns with that, and we were moving along. And then we were asking for information pertaining to where is the inflection of the positive tests. We asked that information. It took a little while to, and then we got that data, and we saw that it was in predominantly 4th and the 1st ward, right? That's the information we received from the tracking data after months of asking for the data. Now we're at this place where this number, and my first question is, out of the 18,669, I would like to see the tracking data to identify demographically where the predominance of this number lies, in which ward. That's number one. As well as deaths. Does it correlate to that number as well? I also would like to see with the testing that we've done, or the testing sites, or how we've broken it down recently, how we have it in the wards. I want to see if that matches the number or the influx of numbers. If it's predominantly in the 1st and 4th, why do we provide resources in the other areas to the same frequency? So I want to see what that trend looks like. I think there was a great question that I had written, and Councilman Abdelaziz poised it, that, one of the things, and we talked about this earlier, the administration said it to the council, was that there's more money. As long as we can show that we've done our due diligence, we're able to get more money. So I think Councilman Abdelaziz's point is profound when he said that we should be writing a letter or sending an email or a request, making a request to say that per our recommendation of our health officer, Dr. Prasad, that 2 days a week is not suffice for the surge of tests, positive cases that we have in Paterson, and based on those statistics. But the problem that we're having is that we've been asking for a long time strategically for a plan. Here's another point that I would like on record. How much of this $9.9 million or the 13.7 have we been reimbursed? I think that's something that I think Council President said will be later on the end, but I would like to know, out of that 13.7, how much of that money will be reimbursed? And if it's not reimbursed, what happens to the city's budget? Will we have to dig into the city's budget to recoup that money until we are reimbursed? How does that look, and what happens to the budget if it's not done on time? The other thing is, I would like to see, as far as the testing sites that we have, how much staff, were they volunteer, were they professionals that were on site at the location? I saw a photo today that was very alarming, and I'm going to put it on record. There was a photo of someone administering a test to someone. They had no gloves on, and I questioned why they did not have gloves. I was told that per CDC, you don't need to have gloves, which I think is absurd, because when you're penetrating the skin with the needle, there's always a possibility of blood that will come from the injection of the needle or whatever. And even if we didn't think it was or whatever, just for safety and because of all of the liability that we have going on in the city with lawsuits, we should always make sure that's in place. That's number one. I also saw in the same photo, I saw open gauze pads on a desk that had papers on there, but they were open and sitting there. And I also saw the person administering the test with the mask halfway across the nose and not fully covered over their face as they were administering the test. That is just one case. I can go into many others that I've seen, I've heard about where people were turned away, all different types of stuff. But these things I just want to put on record to the administration. And I know that there's some great effort being done, but when we have $13.7 million, when we have that type of money, and we're saying we have no money and we have to reduce the testing sites, the math doesn't match. 18,000 or approximately 19,000 positive cases, 443 deaths, $13.7 million, and we're reducing from 6 days a week to 2 days a week testing sites beyond the recommendation of the health who is the professional who has the license and degree. I think that's a major concern. So I know some of these answers, I'm probably not going to get them on tonight, but I wanted to put them on record because this is something that the council, but I've been asking, and we can roll back the tapes, I've been asking since March. These very same questions: what is the plan? What are we planning to do? Do we have enough PPE that will last us? How long will it last us? What else do we need? And I've been saying it, and to get to this point now, to see the reduction of testing sites, especially without having statistical data to match why, at this juncture, when we're in a midst of a surge, those are some things I just would like to see. We did get a breakdown of the 13.7 million of what you allocated it for, but in the 13.7, it's clear to me that we did not identify that we needed these tests, testing sites to stay open. So, Council President, those are my.
Could we let the BA answer the first question, then you could get into other topics, but how much have we received from the county so far of the $13 million?
Yes, the reimbursement so far, we have about 2.3 million has been reimbursed to us.
Out of 13.
We have until the end of March to get all of it, all the receipts, or to have all the receipts and invoices given to the county. So we're in process for all of that.
So the problem we're having, and I mentioned it before, is that we made expenditures in the previous year, fiscal year, which ended in June.
Mm-hmm.
And the conversation that we had is you didn't even reclassify the expense at the time, but now you did, right? Mm-hmm. After I complained about it.
I think our controller was doing it. Our CFO wasn't aware that the controller was doing it as we went along.
Yeah, in October, we were told it was not done. So 2.3 million out of the 13 million. How much, well, you forgot one little detail, Councilwoman Mims. How much did we actually bill FEMA?
So there are FEMA, and this is a clarification that it's all sort of up in the air still. But as of right now, our payroll that we submitted to FEMA was about, I think it was about 1.2 million. But none of those applications have moved. So we might include some of those in the CARES submission, and then we will just do FEMA going forward.
So this is where there's a little bit of confusion, right?
Mm-hmm.
So you haven't submitted anything to FEMA yet?
No, we have submitted it, but there wasn't any action on FEMA side. So we might.
But you gotta wait for them to respond. Either they're gonna approve it or not.
We have waited. Some of them have been in since August. So we can either wait going forward. We're figuring out our final allocation. We had to wait. We are gonna have to wait until like another week or so to get the final payroll that was for the calendar year. Whatever
So-
that, because of the 2-week holdback, then we'll know exactly how much is left.
So,
But one
Madam
thing
Mayor-
I
Hold on,
want to
Madam
clarify.
Mayor, yes, but you could clarify right now, but one thing that gets to me though, if you're able to now charge that 1.2 that initially was not part of the 13 million, that means that you have not spent the whole 13 million because you have not reclassified the salaries. You have not
No.
charged the salaries so far, which I don't think is right.
Council President, that's not the reason, and we're not gonna come, under what an initial expectation was. Some of it had to do with the mobile unit, because we were holding we had a placeholder for that 400,000, but we have plenty of overtime for it. So it's gonna come down to what this last payroll is gonna be, which we'll know shortly, and to be able to figure out what exactly the final number is. But I would like to clarify, this is very important. This 13.7 million that the Councilwoman Mims mentioned, it is no longer available to us, not because of poor planning, but because of the legislation. It was available for use for expenses incurred up until December 30th, 2020.
And we spent it already, right?
The Congress has extended, or the legislation that was signed on December 28th allows states and counties to make decisions about whether there's going to be an extension for use for expenditures that bleed into this year through December 2021. Now, we have spent it, like we have said, Council President. Some of that was for people who were redeployed. Their budgeted job changed into a COVID job.
Correct.
So we can it's pretty simple. We can either, if there's numbers that get extended, we might be able to finish our tech purchases that things were on back order. But we're using that money either as payroll or as a purchase.
Madam Mayor,
All the money is going to be spent.
Madam Mayor, just hear me out for a minute, please.
Mhm.
If you're able, you pass a comment that still bothers me, right? And I work in finance, that's what I do, right? But you told me right now, you passed a comment that just, it's a little disturbing. You're telling me that if FEMA doesn't give us the 1.2, we're able to charge bill the county for the 1.2 out of the 13.
No,
So that means we're actually absorbing that 1.2 into the budget, yes.
No, so Council President, we would use whatever, say we're short $200,000, we would remove that from our FEMA application.
But you already
still
submitted
the one.
Madam Mayor, you submitted
No, but you have until it is finalized and processed. They haven't even started the process for it.
But it's in already, Madam Mayor. They sent you a
Council
check.
President, no, they didn't send us a check. Council President, we don't have
I said
any of that.
if, hear me out.
I understand.
You can't build two grants. You can't build two grants
I
at the same
understand.
time.
I understand that, Council President. Please do not imply that I don't understand that.
That's what you're saying.
That is a huge problem, and we do not do that here in Paterson.
I hope not.
We have been in conversation with FEMA. This is being led by our consultant, and we are not at the point where we need to make a final decision. So that is good, because we're absorbing right now. We do not have a final number for our payroll. So we have to wait until we have a final number. That's it.
Madam VA, no, that's not it. Last time
That's it on this issue. That's what I'm saying, because
last time we had a conversation, Madam VA, last time we had a conversation was more than a month ago. Council members, please, Councilwoman Mims, or anyone else, could you recall when was the last time we talked about a FEMA amount that was submitted? Wasn't it like a month and a half ago or more?
Yeah.
It was more, right? That the administration billed FEMA, and I was complaining, asking, why would you decide to bill FEMA when you had the short money at the county? You remember that whole conversation? So before we were told that months ago FEMA was billed, and now we're being told that it's still not finalized.
Well, I think this is what is the process, that if you're not involved in the process, you don't know that you can bill it, and then there's a whole process that it goes through of various approvals and
approval by FEMA, not us.
Right, and it's called a project worksheet, but they correspond with us. It's not going to happen without our further conversation.
So to finish this, then I don't want to prolong it. Have we gotten any correspondence from FEMA regarding our submission of these reimbursements? Have they made any decisions yet?
No, and we actually told them, we gave them the heads up that it's gonna depend on our final payroll, if we're gonna need to change anything at all. We may not have to change anything. It may say exactly what it was because we're spending all of our CARES dollars on our overtime that we're incurring because we had such heavy overtime in the end of this year. So it's all gonna come down to that, and they know that, they're aware of that.
Okay, Councilwoman Mims.
Yeah, I just want to make sure, because I listed some things, and I just want to make sure that all of the points that or request and everything that I stated, that you got all that information, Madam VA?
So, yes, Council Vice President, I think the information, and I wanted to note this, the data that we have about demographics is all listed on our dashboard. We don't have necessarily ward data for all of the 18,000 cases. We do have...
We received it in the past, so I want to ask you for something that you didn't give to us. There was a news article done based on that data showing which ward had more cases, so...
We have, okay, I'll have to double check that. I know we have deaths by ward on our dashboard. I know we have demographic information by cases, because that's what people include.
Madam VA, the reason why, I'm just putting it out because Dr. Prasad, he's on, I don't see him, but I'm sure.
Yeah, I was like, we can ask.
Yeah, he's on. I don't have to ask him, I know, that's what I'm saying. It's a fact that it was done, and there was a newspaper article. But I'm putting it on record because when you're making these decisions, the Dr. Prasad, the tracking data, and this information should be driving the decisions. And that's why I'm putting it out again to this administration. I just want to see that date. It was given to us, but first of all, we asked, and I know the council remembers that, we asked for that data for a long time, and we were told initially we couldn't have it. Then we finally got it, the information, and it showed which wards had more than others. I'm just asking for that data based on this 18,669 number, and why this has not been the driving force for site information, for making sure we're in those particular areas that are more highly populated, or identifying some root cause analysis. That's beyond this, but I'm just asking, why have we not done that? And if we have done it, just send it to me in an email. Just send it to me. I'm not trying to prolong the meeting, because that's a part of the census tract data. I just want to get that information, and I just want to make sure that you have everything that I've been asking to get the information for.
Thank you, Councilwoman Mims. Councilwoman Cotton.
Thank you, Council President. I say that this COVID-19 that we're in, they say that there's another strand of bacteria that's coming out, that's in the United States right now, is in like 3 states. So, there's a lot of things that that we need to be looking into. I wish we could do more testing every day. I know I like the idea when they came in each of the wards, and each ward, you knew that they were going to be in whatever ward, whatever day, which I thought was an excellent idea. I personally went out and tried to get people to come out and get tested. I know that, I guess I hear so many phone calls, or I hear so many things, but I just want to say to you people, my council colleagues, my people out there, this United States of America knew this back in November. They knew all this was going on back in November.
Okay.
They wanted to get through Christmas. They wanted to get through the Super Bowl. They wanted to make sure they made money. This United States of America knew this was happening and said nothing. And we lost lives, because they wanted our President Trump, who is no longer president. I just need to put it out there, Council President, because we want to make sure that everybody in the city here get tested, and we want to make sure everybody in the city here is treated fairly, and we want to make sure that everything gets done, but we don't want to put the blame on the people we should have started from the get-go. Because you know what? There were people sick in October, November, and December, and they knew nothing, and they didn't know what was wrong with those people. They had no idea what they had. Then all of a sudden, it's all about making money. And I want everyone here, if we can get more, but there's another virus. There's something else coming out. And it hasn't gotten to us yet, but it's coming. And we need to have our Dr. Prasad. I know they said that it's in 3 states, but we want to make sure that we can make sure that people, and I hear people, family members who know they're positive and they go around their families and you have families of 20 and 30 and 40 family members. You have a husband and wife in a hospital. You know what? All because they didn't want to tell us back in October or November or December that this was happening. And you know what they said back then? You know, when people went in, and a lot of people went in sick and did not have COVID, but caught COVID in the hospital because the hospital didn't know what to do. And you know what they tell you? TV land, people out there watching, and I know we all have had so many family members or friends that we done lost and we can't understand. You got family members, you got everybody, you got. But my thing is that we want to make sure, and if we can fight to get more, we got to say to Congressman Pasquale, Senator Mendez, Senator Booker, if you can get us some funding, please, we need all the funding that we can get in the city. County, you know, if you can give us some more funding, because everyone, you know, and there's people out there, and we say to them, please, if you have the virus and you're not telling nobody, like that is so unfair for you to be walking around here and spreading it like it's nothing, and you have your whole family, 20, 30, 40 members of your family getting sick or getting or even passing. But my thing is that I'm mad with the federal government for not telling us and how to prepare us and how we should have gotten prepared, because we should have been able to. But it's all about making Christmas money, all about making Super Bowl money. It was all about, you know, you can't you go around this country now, there's still governors in this United States of America that don't want to shut down, don't want to make people wear masks. You know, you hear this craziness and it's like unbelievable. But if I'm saying to our BA, to our mayor, to our health department, to Dr. Prasad, if we're able to get more, and sometimes you gotta like go out there and say to people, please, you know, you need to get tested. We need to, if you haven't tested, you need to go out there and get tested. We need you to do this. And I'm saying, yeah, just so much that has to be done. And we wouldn't be in this. It's just sad when you look back up. We look back at this 2 years from now, we're gonna say, you know, well, there's so much stuff is gonna happen to kids that in 2021, there's so much things that are gonna go wrong for families. You know, everybody's gonna need to see a psychiatrist in another year from now. What happened? You know, people who haven't gotten a paycheck since March, people who haven't been able to pay them. You know, there's so many things out there that's going on. For us sitting here, most of you, you know, we get paid, we get a check. You know, we're able to live. But there's so much stuff, and I'm saying when 20 start rolling in, 2021, I'm saying to us, to our BA, to our mayor, if we need to get more funding, like I said, I love the testing, but people are out there now not doing the right thing when it comes to their families. They're exposing them, and they should not be exposing them, because you don't know, and we have a new strand, they said, coming out. God help us. I'm not sure what's going to happen to us. I wanted to share that because, you know, and you know, let me tell you something. You know what it feels like? And I think I need to put it out there in TV land. When they tell you, when your family expired, that they're not bringing them back. I need everyone to know that out there. They tell you that they're not bringing them back. So, you know, this virus has really done a lot to a lot of us. And I think that we need to share some of our stories and let people understand the importance of it. I'm not putting no blame and doing anything, but we need to try to Very well. Thank you, Council President. Councilmembers. I needed to share some of this stuff with
Thank you,
you,
Councilwoman.
and we need to do our best to work with everyone to make sure that we get this thing right. And we help those people out there who's not doing what they need to do. Thank you, Council President.
Thank you, Councilman Mendes.
Thank you, Council President, and, this is a very serious conversation that we're having here, and, our fire chief make a great comment tonight. You clearly say that, he is the fire chief, and he make it happen. He got those lab, running at those side, Kennedy and East High School, and let me remind my colleague that I wasn't here in the beginning of this pandemic. I concentrate into through my nonprofit, just providing service with the face mask and, the distribution of face masks, glove, hand sanitizer, and also promoting all the sites around the city of Paterson. And maybe that's one of the reasons why I'm getting a lot of complaints, because through my social media, I was constantly promoting all the sites, and I concentrate in Kennedy East Side because most of the people in Paterson are Pattersonian. They know very well where those sites are. Now, the chief said, he's the fire chief, and my concern is that I do believe that those sites, there have to be under the supervision of the health department. And this is, for me, it's common sense for me. And I still try to understand how this decision was made by, getting those sites and putting, maybe the chief under, he got it done perfect, and we know how it works. So now, going back to Dr. Prasad, and I know some of my colleagues asked this question, but let me remind you again, I wasn't here when this whole issue started. I think it was Council President that asked this question. How was the process for those testing sites to get into the city? What was the agreement? Dr. Prasad, and I'm going to bring this question back to you because I'm trying to understand if you were fully aware and it was your recommendation of those testing sites and because I do believe that you have to be the one on charge of overseeing those sites. So I think that we have to correct this because we have to remember that in the beginning of this pandemic, we didn't have any testing site. We had it at William Paterson University, and everybody was struggling in Paterson because we have a lot of Pattersonians that they don't drive. They depending on public transportation. We have thousands of people infected. They couldn't get tested. So now we are at this stage. I already hear that there was some issue with the lab, and we made some changing at the last inning. So, but I want to bring this back to you, Dr. Prasad, because at the end of this meeting is my goal that you are the person that oversees those labs, because I know it's about funding, and I also I feel really concerned that the administration wait until this time just to say, we don't have enough funding. We're gonna cut the testing from 6 days to 2 from the health department, and that's something that has to be corrected.
So council members, the intent of this meeting is also to get to make some recommendations also, right? I know you're next, Councilman Jackson, but what I'm about to say is the following. I think the major cause here is not the actual overtime for the testing site. I think the major cause is also the lab, what the lab charges. Dr. Paul, let me ask you a question. LabCorp, do they bill directly or do we have to still pay them?
That's a very interesting question, Councilman, and that's not a yes or no answer. I'll have to explain to you briefly, if permit me. LabCorp, the reason we have LabCorp is that for those who have insurance, because those who have insurance, the CARES Act will not pay for their test. So for those who have insurance, their insurance is billed.
Correct.
For those who do not have insurance, then the arrangement we have is that LabCorp bill us and we get the money from the CARES Act. Now,
Okay.
Now, I just want to say something, that this is actually very, very new information I've not shared. I did mention it briefly to the mayor, that when when I was in discussion with LabCorp, because I know that LabCorp can also, bill the CARES Act directly, and they do not necessarily have to bill us. Just now, I got confirmation from LabCorp that LabCorp will bill those who have insurance, and LabCorp will bill the CARES Act directly for those who do not have insurance, so they do not have to bill the city anymore.
So that's perfect. Dr. Paul and council colleagues, Councilman Jackson, you might get some benefit out of this also. So we have a report from the VA at 5:08, I got it today, I requested, not because she was late, but I requested this information a little late. But I'm looking here, it says here, Wednesday night, 5 hours, and Saturday 6 hours, right? Dr. Paul, if we perform this test during the day also,
yeah,
there's no additional cost because we have the employees already during the day, right? The additional cost to the city, it would be the overtime, is that correct?
Yes, sir.
But let me just share these numbers. So right now, Madam BA shared the following numbers. Staffing for overtime. You gotta have program specialists, three of them at $60. Make a long story short, even a mechanic is thrown in there, but that's only for 1 hour. $3,159. You hear this, Councilman Jackson and my colleagues? $3,159. And this is for 6 hours on a Saturday and 5 hours on a Wednesday. Now, if we take this testing out of there, the lab cost out of there, if possible, the lab cost is, let me see, cost of testing, 240 tests per week at 100. Make a long story short, you have $24,000 here. If we take that out of the equation, then I don't see why we need to, if we could confirm that LabCorp would bill directly, I just don't see a need to reduce the days tremendously.
I agree. I'm with you 100%. This is breaking news to me, so.
No. It was just, listen, that's the intent of this conversation, to arrive, and I'm sure Dr. Paul always doing research out there that we could give him. He's always looking into things, and I appreciate that, Dr. Paul. So, at least we're gonna come out, the intent of this meeting was not to bash anyone, it's just to fight for our residents. Councilman, my council colleagues have been vocal. I'm sure the administration is trying, their best, but we need to do better, right? We need to do better as a group, council and administration together. Now, Dr. Paul, all I'm asking is look into this, and I want to follow up this week from the administration as soon as possible to see if we could extend. And also, Dr. Paul, if we could do the testing, let's say we could do 4 nights a week. Let's just say, or 3 nights a week. And you could just do 2 days a week during the day at the site, or whatever you decide. It could be on Broadway at the building, the health department, or in the parking lot, or somewhere else. If you do it during the day, then there is no overtime cost associated with that. Is that correct?
There is no overtime cost with doing the testing during the daytime. There's only very little additional cost.
So
the whole intent of this program, Council President, is to increase access to the population. That is the reason why I put a 1 day per ward. I could have set up a tent outside of the health department and asked you to come. There's a lot of that already in this city. I thought, for the benefit of the city, that let's take the test to the ward. Because we want to increase access so people will be able to test more easily. And there's no reason for me to do the same thing that every other test inside is doing. So I'll tell you, I confirmed tonight, just minutes ago, I was discussing with them this. There's only one issue, is that in the event that an insurance company refuse someone to pay for a test, then they can bill the city. I think that's going to be few and far apart. But LabCorp has confirmed with me now that they can actually bill the CARES Act directly for those who don't have insurance.
So Dr. Paul, at least something positive is going to come out of this meeting.
Yeah.
So, Madam BA, if you think about it, right, 2 days a week, including a Saturday, which is maybe double time and a half. Yeah, time and a half. That's only 3,159 for 5 hours at night. That will mean that you will have testing all day during the day and 5 hours on that Wednesday, right? After 4:30, I guess. Whatever the time may be. Dr. Paul, on Wednesdays, what's the plan that you currently have right now to shut down at what time? Testing site.
9 o'clock.
So 9 o'clock. So that's $3,000. That's $3,000. So if we could increase by 2 more days, maybe. The majority of the expense here is associated with public safety, to be honest. Is that correct, Madam BA?
The majority of our overall COVID right now? Yes.
Overtime,
right.
not the lab calls, but the overtime.
Exactly, it's backfilling our police and fire, mostly our fire.
So I think that the services that we're providing from our health department, if we don't have to pay for the lab cost, it will be minimal. Could we say that?
Right, and I think that the one thing that I would ask is that for Dr. Paul to sit with Director Castillo to look at the staffing of all of these things, because the contact tracing is continuing. Some of the people who work at the testing sites at night are not there doing contact tracing during the day, so they might not be able to do testing during the day. And we also have the vaccination. So as long as we have that staffing plan in place, the numbers and this breaking news of the testing, the price of the testing and not having to pay for that, then yeah, this is absolutely doable. But it is something that I know Director Castillo wants to make sure. And
let's look into it.
So
Director, and then we have Councilman Jackson. He's been waiting patiently.
No, I just want to make sure, and I agree with Madam BA, it is news that we just found out. But I do want, before any commitments are being done, that we have the staff. We have an amazing staff at the health division. We're just running them ragged. They're doing a great job. They're doing multiple things. They're contact tracing, vaccinations now. They're doing the testing, and also their daily duties. And we have a lot of our nurses, our clinics haven't closed. Yeah, so I just want to make sure that the plan is one that makes sense for the community.
Yeah, but Dr. Paul, let me ask you a question then. You already have some job postings right now, that's one. Is there anyone that, actually I'll let you do your assessment on your staff, but it has not been an issue as of now. But if need be, could we subcontract a few people under your supervision to do some of the services? Under your supervision though.
For what services?
I'm not suggesting we do that. All I'm saying is, I don't want any excuses for this not to be done. This test needs to continue. If in fact we could save on the lab cost, I just don't see why we need to stop. That's for the administration to calculate. We need some numbers to see how many days a week. But it definitely have to be more than 2. Definitely more than 2. Councilman Jackson.
Thank you, Council President. First of all, before I move into the line of questioning again, Director Castillo, so we understand that your staff has been stretched thin and overworked. Has any of these staff members who've been out in the front line rendering support to the community, rendering tests, have them been paid hazardous pay as well?
No, well, Health and Human Services, no, not hazardous pay. Our departments have been open as usual. And then obviously testing started end of October. And that's when they started more of that frontline work. We have amazing staff.
These employees, I'm sure, I've been out to the sites, I've seen the staff doing a phenomenal job. But these employees, because I know that there was some portions of the employee base that was segmented to say that they don't qualify for hazardous pay. Do these the job that's being done by these employees, are they entitled or capable of receiving hazardous pay?
So the titles that fall under hazardous pay, that's a conversation that I don't know the fine-tuned details of. But as of right now,
wouldn't you be the person to advocate for your staff who is out in the front line?
Council President, can I jump in here on this?
Sure, Madam BA. Given that the administration already have done their research with their corporation counsel, I'm sure outside counsel, labor counsel,
So,
you guys have looked into this already.
yeah,
DPW have been paid some. Could we let Madam BA please just tell us what was the outcome? Because I don't want to go around. The intent of this is to make recommendation and improve the services for the residents.
so I would say this, I am 100% the person to advocate for my staff, and I have, and we've also consulted with our corporation counsel, and I am sure that everyone who was needed to be paid, or that fell into those guidelines has it, and we've looked into this ad nauseum. I know our corporation counsel has talked to other cities, they've gone above and beyond to try to figure out the best way to support our staff who have done an amazing job, but it does not mean that we haven't done it, because we love what we do. We've been doing this job, but of course, Dr. Paul and he is an expert at advocating for his staff as well. Unfortunately, it doesn't have to do with advocating just for staff. It's about following the laws, the regulations, and the guidelines given to us.
Could we hear from Madam BA and the Corporation Council?
Sure, yes, thank you, Councilman. Yes, this is directly an issue of law. It is how the law is written. The statute for it does not allow for hazard pay for everybody. And so the city is, and then we asked and made sure we clarified that with the Passaic County Review Committee on the CARES dollars. And so that is one of the essential points that we're standing on for hazard pay for the city. What the Councilman Jackson was referring to was contractual pay that was separate. And I can let Corporation Counsel speak to that.
Contractual pay. I'm talking about these personnel people work under the purview of the health director who are out on the front line rendering medical support, doing testing. Are they entitled, or are they not entitled, but are they classified under those provisions of what you just talked about? Are they classified to be accepting, or for the city to be qualified to receive hazardous pay? Specifically, I'm not talking about the entire staff. I'm talking about these employees who are rendering medical services, testing, and now going to be administering vaccinations. Are they not capable of receiving hazardous pay based on the standard that's been set by the federal guidelines?
Councilman Jackson, I answered the question as to how the administration is. I have, so.
No, you did not answer the question. Are they, Council President?
I answered the question as to how we are using CARES dollars, and that it is not something, because not all employees can get hazardous pay. The administration decided not to do it, because how do you tell someone who works through the pandemic at the tax office that they don't deserve it because that's part of the law, but somebody else who sat, and did contact tracing in the health division, that they're able to do it?
Well,
so
you tell someone that based on the law and their specific position is different. How do you pay officer? I'm sorry, please. I have the floor. How do you pay a police officer in excess of close to $10,000 to do fogging when he's not hired to do fogging, but yet you have employees on the front line rendering support? Council President, I'll change the line of questioning, because apparently I'll take it. The answer is the administration decided not to pay anyone hazardous pay, whether or not they were eligible by the federal government or not. So we'll rest it there. But with that being said, Council President, and I cannot help but to reiterate on some of the numbers that Councilwoman Mims had quoted off. Early on, and Council President, please correct me if I'm wrong, we were allocated $80+ million by the federal government to the county, of which Paterson was designated close to $38 million.
No, that's not correct.
Okay, so what is the correct number, Council?
So what the county decided to do was, out of the $87 million, they did a first round, and it's all over the newspapers. They did a first round in which they allocated $29 million to the 16 municipalities. Of the 29 point something $million, the city of Paterson got like 8 point something million.
8.5.
Then, yes, they told the city that if we spend that money, any municipality that spend the money, they could apply for more, right? Because they only started with 29 million, the allocation 29 out of the 87, which was for also the county to use some of the 87 for them to provide the services also. Now, the city later on decided that they wanted to ask for some things for the district. The county could not provide that money directly to the district because the directive is for the money to be allocated to the municipalities. Now, the municipalities could ask for the money, not for the resources, not the money, the resources, and donate those resources to the district. So in total, it's about $13 million. Am I correct?
13.7.
Yes.
8.5 the first round.
13 million and some change.
Council President, that is totally incorrect, and we can go back to the video.
How you figure?
I sit quietly when you guys are answering. I would like to receive the same amount of respect. So if you recall, and my specific question was based on the percentages of population. Are we receiving our fair share of the 87 million? And then it was specifically expressed by the administration that the 38 million was based on our population size, because we talked about it then when we weren't rendering testing. Now, here's the thing. What happened was the county is allowing themselves to be able to absorb so much more money than we are because they rendered the services from the beginning of this pandemic. We cannot go back and request revenue for services that was not rendered. So what's happening now, the city failed to render certain services, so we cannot go back and bill against the $87 million that was specifically allocated for us. Now, when you talk about testing, if you look at the testing that's laid out by the county, next month, not one site is done within the city of Paterson. So the fact that we are cutting testing in our community is a great concern. Not only that, if you listen to Councilwoman Cotton's specific details that she laid out relative, which is accurate, has been talked about throughout the CDC, that there are additional strands of the virus that may begin to resonate. And with that being said, if we're not testing, then how do we know who's being affected by the change in the virus, and or who's being impacted positively by the vaccinations? Not only that, there's a list that the director Castillo sent of all the various locations that you can receive testing. None of the other testing sites are doing contact tracing. So if you look at the job that's being pulled away from our health director, you cannot do contact tracing if you're not doing testing. So again, here's another avenue in which we're failing our community. Now, when you look at the fact that the county and what numbers they're able to draw down is because they rendered services that we failed to render. So, specifically, Council President, I'm going to make sure I go back and I find the video. I'll air it later on today on my social media page when we talked about the numbers, because it was $38 million. It wasn't $13 million. It was not such a small number of the $80+ million. The fact of the matter is we're failing to render the services, so we can't go back and claim these things. We should have never been billing FEMA. The money was allocated through the CARES Act, direct medical professionals making decisions, detrimental decisions for our community that ultimately a lot of us are going to pay the price for. And I just leave that there and allow you to absorb it the way it needs to be, Council President. But we need to, you as a Council President, maybe you should do more research on how exactly a Board of Health meeting is supposed to be conducted and how the decisions that are supposed to come from this meeting is supposed to derive.
So first of all, real quick, this was necessary because the actions, I've been on the council for 2.5 years. All the actions have been taken by the administration. The health officer has not been involved during the beginning of this pandemic. He was not involved in a lot of the things that took place. So in order to have a productive meeting, it's important that that the administration is present, because there's other factors also. There's budgetary factors. So, I appreciate, your feedback. But you know what? To elaborate a little bit more, let me ask Corporation Counsel if you want to, chime in on the comment that was passed pertaining to the health board.
Sure, Council President. So regarding the Board of Health is an advisory board. The Board of Health does not make decisions. They give mere advice. They can provide counsel, but they don't make decisions, because under the FALCON, no employee of the city is directed by anyone other than the mayor and or the appointing authority, who is the VA in the city of Paterson. So while the Board of Health can absolutely convene, and should convene, to make sure the public is aware of whatever the issues are, whatever's going on. However, in terms of decision making, that is solely an administrative prerogative. So while the Board of Health or the council in this juncture may have concerns, your role is to provide advice, to ask for something different to happen. Of course, as the council, you can draft legislation and such, but it can't go against the Faulkner Act.
So to that point, I'm glad we don't have a board as of right now, and the council could, force our hand. We could force our hand, and if the administration says that we don't have the money for the testing, we could always reallocate funding, increase a line item with 6 votes. So, Councilman, just like you always stated in every meeting, the council needs to be doing more. The intent of this meeting was to get some exchange of information. I read an article that was disturbing, that the administration made a decision without providing information that should be relevant to that decision to the council, right? So to that point, I think we've somehow, hold on a minute, Councilman. I think somehow we accomplished so far what the intent was, to have a discussion. I believe that Dr. Paul's gonna go back and check my recommendation to see if actually the LabCorp will pick up the cost or bill on their own, and we could increase the testing. Either way, my opinion as a council person is that we need to be more accessible to our residents. I believe, who's next on the list? And let's try to wrap up this meeting, because we're going around, and the intent is to get things done and make some recommendations. Right? Get the information and make some recommendations. That's the intent of this meeting. That's what I believe. I believe Councilman Abdelaziz.
Thank you, Council President. And you're absolutely right. To convene here, to look for solutions, to deliver services to our residents. We could sit here all day and say, oh, this should be done, that should be done. What are the solutions? I got a few questions for our health director. And Councilman Jackson said something very, very good that I want to address the health director here. One, you found out, and the BA, because none of the council members were part of this discussion, this wasn't brought into our Health and Human Services. When we decided to scale down on testing, did anyone reach out to the county and say, hey, could you guys do a testing day in the city of Paterson on the month of January so they pay for it? Because the residents don't care who's testing them. The residents want to get tested,
right,
get the result, and say thank you very much. So in your planning, because these are partnerships, did anyone from the administration or the health department reach out to Dr. Gungil at the Passaic County Department of Health and say, hey, Doc, we're scaling back because of funding issues. Do you think the county will host testing on one of the days in January, maybe twice a month, 3 times a month? Dr. Paul?
Councilman, this happened over the holidays. I'm accustomed to seeing that the county set aside 2 to 3 days of testing in the city of Paterson. I'm surprised to learn that the city council, that the county did not schedule.
We asked, Dr. Paul, Dr. Paul, the question was, did we ask, Dr. Paul?
But I wouldn't ask because it's our.
So the answer is no, Dr. Paul. That's what I'm saying. That's why I guess sometimes I lose patience. So the answer is no.
By me saying no, by me responding no to that question would put some questions cannot be yes or no. No, the short answer is no, I did not. But why? Because the county has always tested, has always allocated 2 or 3 days for Paterson. I do not know why they have not done so this time.
That's a better answer, Dr. Paul. That's a better answer. Thank you. Yes, continue, please.
And I understand, and the county did allocate 2 or 3 days, and if it's my understanding, in the month of December, right? The month of December, the county did not have anything in Paterson. So the entire month of December did not have any Paterson sites. And I won't blame the county because we were doing it 6 days a week. Why would you duplicate a service when we're there? In December, the county wasn't in Paterson. So I would want us to reach out. That's an entity and a partner right off the bat that we may get a day per week. We may get that. We don't know if we don't ask, right? No one has asked them. In the month of December, I'm looking at their calendar right now, and I could probably go to November. I don't think they did it in November either, Paterson. The last time they did it in the city of Paterson, if I'm not mistaken, is in September because we weren't doing testing. And then in October, we were doing testing.
You were the Paterson Catholic, right?
Not in September, I think.
September, Paterson Catholic. I remember. I went there.
So, and that's good because we picked up testing. Like Councilman Jackson said, we started rendering the services, which is good. It's 6 days a week. But now we're here in January. The administration made their decision, and I'm looking at it. And Councilman Jackson said, "I was wow, you know what? The county is doing it all. Maybe did we reach out to them and say we scale back? We could use you guys a day a week. Could we reach out to them and say, hey?" We're doing it twice a week on Mondays and Wednesdays and Saturdays. Could you guys do Tuesdays? Could you guys do Mondays?
Correct.
They're a partner, right? It doesn't matter. The residents have not called me up and say, I mean, other council colleagues, I think you guys could chime in. Has anyone called you and said, who's testing us? So, Council President, you're right. We got to look for solutions.
Yes.
We got to look for funding. If we can't do 6 days a week because we're not there, we should be reaching out to our partners. Let them say no to us. And then we reevaluate it. But I from what I'm hearing, Dr. Paul and the Madam BA, did the administration reach out to the county?
Councilman, I just said I did not because this whole decision happened during the weekend. It does not happen all the time.
Dr. Paul, he also is asking the administration, but sometimes you're not involved. So now we want to hear from the administration. You already answered that. Madam BA, or Council Director.
Yeah, so we actually had a meeting with the county today. Dr. Paul is right, this whole conversation happened during the holidays. We've been trying to figure out the best scenario to complement while we look at what the funding is coming down the pipeline. So we did have a conversation with the county today, Madam BA, Corporation Council. We met with Dr. Gungill, Mr. Genova, and Kelly Rafael, who's the who's the assistant administrator, I'm sorry. And we talked about how we can complement some of these services. So they are willing to do a rotating schedule, which is something that they have with other cities, with Wayne and Clifton and Passaic. So we can have that conversation on how to fit in the rotation, not only for the testing, but for the vaccines as well. So the days, if it's Saturdays or Wednesdays, right now they're not speaking about evening hours for the vaccines because it's just 1B, but they are planning to expand that as we move forward.
To conclude, go ahead, Councilman. And Madam VA, that right there, see, that's something that we can get out of because you know why? If they give us a day, that brings our costs down to include days, right? So instead of $3,000, now the county's subsidizing. I'm going to ask the director and the health director and the human service director and the VA. I read the city of Hoboken is having testing, and the New Jersey Department of Health is doing it on one of the weeks. I don't know if we reached out to them. That could be another day. If we can't find funding, let's look at partners that are getting the money because New Jersey's also getting CARES Act. So That's it, Council President. And lastly.
Thank you, Councilman.
Councilman, lastly, is the chief on here? Chief McDermott? Is he still on?
I don't think he's on anymore.
He probably left.
Alright, I gotta give a shout out to the chief and commend him, because I know we talked about these off-sites are private, right? Well, back in in early on, when we didn't have sites and there was people that didn't show up, the chief stepped up to get testing
Step to
rolling.
the plate, yep.
Yes, he stepped up to the plate.
Yep.
And it may not be perfect, but you remember back when we gave a contract out and no one showed up? The chief was out there. So I gotta commend the chief and give credit where credit. So could things get better? Absolutely. But the chief stated, we took a fire chief, he stepped up to the plate, we checked our egos at the door and said, what do you need me to do? That's what you do during a pandemic.
So Councilman,
That's it, Councilman. And that's not
Councilman.
I just want to commend
No, I agree with you 100%. The reason we criticize that actually wasn't criticizing the chief per se. We criticized the administration because they did not involve a health officer.
That's right.
That was the issue.
No, that's not to my council colleagues. Sometimes we
I
don't.
just want to clarify.
No, it's not to you guys. It's not to you, Council President.
Yeah, I just want to clarify.
The health officer, I forgot to commend the chief because he stepped up to the plate. That's all.
That's fine. No, but you made a good point. Listen, council.
About the state partnership as well.
Sure. Right after that, council members, listen. You know, I truly miss you guys after the holidays, and I like to hold these meetings. This is great, but I think we already made a lot of progress. I'm gonna let the director, give her statement, and then we might have to wrap this up. If you don't have any recommendations or suggestions, which is the same thing, but I just don't see why we should continue.
I agree.
Director?
So apart from the county, which you'll see more collaboration in soon, we also have the state. So all of the nonprofit agencies, the shelters, the recovery centers, they're providing testing for those individuals. So we've done about 4,518 tests, regular tests, and 128 rapid tests. So we have the CDC Medical Foundation staff. The state is providing the test for us. They're actually doing the testing, and we're sending it back to the state lab. So we've done the 128 rapid test in an emergency situation at a shelter. We were able to get everyone tested and into hotels, and all of the agencies are on a rotating cycle. We've added CUMAC to that cycle, and we're going to be working with the fire department as well to do additional testing. And just one more thing on the senior side, I know we've had some discussion about the entities at some of these locations, but we have partnered with these entities and some others to do testing for seniors. We actually had 3 buildings tested in December, and then within this month, you'll see the additional buildings of seniors getting tested as well. We're talking to them about helping us roll out the vaccines for seniors as well.
So, Dr. Paul, real quick, and we're wrapping this up. I just want to let the residents know that due to COVID, it may seem that it's due to COVID. I've gotten several calls today pertaining to recycling. I hear that we only 6 employees came into work today out of like 20 something that we have. So, Dr. Paul, my question is, do you quarantine most of these employees, or they just call out on their own? I'm not asking you for names, just it's a general question.
I wouldn't give you names either.
No, I'm not asking for names, not interested in that.
I have to think before I answer the question. I can't say yes. Some of these questions are not, they may, on the surface, they may look as yes or no answers, but it's not. I'll tell you how the process works here. I may not necessarily quarantine everybody, but somebody on the team who's doing contact tracing would have probably called them and may have quarantined them. I wouldn't know that. So these questions are not yes or no answers. I have to give a couple of sentences to explain this so you can understand. I'm not the one that quarantines everybody.
No. When I say you, I didn't mean you per se. I'm talking about your staff or whoever. Because out of 20, I think it's like 27 employees. 6 of them came into work today.
Usually since the start of this pandemic, most of the employees would call me and I would say, decide to quarantine them early or isolate them early to avoid spreading the virus. They still do so. but I do not have any recollection of 20-something people.
No, that's fine, listen, that's fine, I just wanna let the residents know that they're having difficulties today picking up the recycling, because out of 27 employees, only 6 showed up today.
Well, I don't know
So-
if that is related to
No, but-
isolation or quarantine either.
Sure, and if they're quarantining, then we have to find a way that, employees, maintain their distance, when they show up to work. Because to have 27, you don't even see that on the NBA. In the NBA, where they practice together, they're all quarantined. They're not quarantining a whole team lately. I see all the time that whenever one of them tests positive, I know they have testing every day, but I don't want to get sidetracked here. The bottom line is that people are complaining. Be patient. They are out there collecting your recyclables. Madam BA, could you please look into this tomorrow to see what the situation is?
I just want to add one thing to that, Council President, is that a lot of the employees in the city of Paterson that actually becomes positive, it does not necessarily mean they get positive on the job. A lot of people get positive because they have life, their own situation. So the city, I can tell you that much what the city has done. The city has always reinforced and advocate for contact tracing. But obviously, when people leave their jobs and go home, in my experience, this is what is happening.
Dr. Paul, but I'm not insinuating that they get in it here. What I'm saying is that whenever one person tests positive, now they're all got to quarantine. So I'm questioning, are all these people all together in one room? But again, we don't have to get into that. That's your job function. I just have some concern about that. And I'm wondering if it's due to COVID or people just called out. Because that ratio is pretty high. 27 employees and you only 6 come in, that's pretty high, I think. Council members, could we have a motion to close this meeting?
Move
Okay, so is there,
We did the public portion already. So moved by Councilman Mendez, second by Councilman Delacis. Roll call?
Yes, Mr. President. Roll call to close the special meeting of January 5th, 2021. Councilman Abdulaziz.
this was a productive meeting. To the administration, to the director, thank you for your hard work. You're the bearer of bad news. People don't want to quarantine. They won't do this. You got a thankless job because those are tough decisions you have to make. To the administration, I think the consensus is more testing, right? Figure it out. Look for funding. Look for partnerships. And try to deliver, right? That's the job that we're looking for. On the other entities, let's improve the services that they're providing. If not, then let's cancel that partnership. And as always, my message to the 6th Ward, I have to always give a little message to the 6th Ward and to the whole city, because it's open to the public. We have many testing sites outside government agencies in the 6th Ward. In South Paterson, you have Shifa Pharmacy. You have Pharmacy Plus on Main Street. You'll see the lines out there. Insurance, no insurance, they test you. No appointment needed. South Paterson section. On the Lakeview section, we have Pure Med Pharmacy at 353 Crooks Ave. Not Paterson, but right on our border. I see many of my Lakeview residents going over there. In the People's Park section, we have St. Joseph's at 11 Getty Avenue, that many council colleagues of mine have gone there to get tested. They run a very, very good operation. And this is every day, 7 days a week. I would hope the administration hears something else that we could put up there on our city, on Channel 77 and our website. We should look at every agency in the city that has testing and let people go on there and look at where they want to go. I'm sure there's many pharmacies around the city that are providing it, many doctors' offices. Let's get the resources out to our residents. Get tested, be safe. My medical friends tell me that January and February are going to be rough months, and that's why, Madam BA, the testing needs to continue. They tell us these 2 months are our darkest months coming in, and hopefully we get by. And Councilwoman Cotton stated it best. You can see it in her passion. It's hard losing family to this, and let's hopefully get through it. I went through it. Council President, good job. My vote is yes.
Thank you. Councilwoman Cotton?
Thank you, Madam Clerk. I just want to say to everyone out there, it is so important that you do get tested. I know I have some doctor's office in the fourth ward that are doing testing, 10th Avenue. I have a few drugstores that are in the fourth ward that are doing testing. I know for a fact that Walgreens is testing. You make an appointment. You can make an appointment. Usually it takes 3 to 4 days before you're able to get in. But they will test you without having insurance. They will test you, and that's one good thing I can think. I'm not quite sure how the Walgreens corporation is doing it. If someone is paying them, but I'm not quite sure how it is because they're all over doing it at the Walgreens. I just want to say to you, everyone out there, please, if you don't be a spreader. Please, if you know something is wrong with you, please do not come around people. Please don't be mad because you have it and you want to give it to everybody that you come around. Please, that's what we do not need. I know that for the Madam VA, our mayor and our health officer, Dr. Paul and O'Sheen, our director, we must go out there and do all we can to make sure that we try to partnership with as many. I was just really surprised that the county did cut back, and maybe so because we were doing it every day in the city of Paterson except for on Sundays. So, but now we have to reach back out to them and say, you know what, we need for you to come back into our city. We need for you to help us, whether it's the county, reach out to the state of New Jersey Health Department, that we need you to come in here. But I want to say to the community, when you see it, please go get tested. Please, don't. Sometimes you get angry. Don't get angry. We don't understand why things happen. We do not understand. So, if you got the services out here, please take advantage of it. Please just take advantage of it. And that's what we need to do to you all, everyone out there. With that being said, to all my council colleagues, to council president, have a good evening. I think this was a meeting that, I think we heard everyone's side of the stories and everyone said what they need to say. And believe me, all of us has been so affected. And I said, year 2021, godly, a lot of us is gonna really, we see with our poor children in school, but a lot of us, it has affected a lot of us. And a lot of us need to still be thankful and helpful and kind to one another, because so many people are going through so many things. So with that being said, Madam Clerk, my vote is yes. We got Deputy Madam Clerk here tonight, right?
No, she not. She left.
Oh, who's this?
This is Sonia.
Oh, Sonia, all that time, that was you all that time. I'm so sorry. And I thought
she lost her dad today. Her dad died today. So
oh, godly.
I mean, I take the meeting.
Oh, wow. I am so sorry. I'm so sorry, Madam Clerk, Madam.
Yeah.
Oh, all right, please. Yeah, I'm so sorry. Please give her my condolences, please. I'm so sorry. I thought it was Jackie. I'm so sorry.
And I wasn't here today. I was coming to do the meeting.
Okay, you did. Thank you. See, that's the trooper in you, Madam Clerk. That's the trooper in you. Wonderful, wonderful, wonderful.
Thank you.
With that being said, Madam Clerk, my vote is yes.
Thank you. Councilman Davo?
So for many, it's very obvious, that this is something that we've had a rough year. 2020 was definitely a rough year for many, especially those that have lost loved ones. I take and I become passionate at times, and sometimes it comes across as angry. And yes, there are times that I am angry. But the reality is that yes, we all have a responsibility. I don't take jabs at people. Okay, people like to take jabs at me. And I need to put on record, all right, and I've said it before, that one of the things I didn't like was the double standards in our city. The double standards with, who can quarantine and who doesn't. Who gets notified right away, who doesn't. Who tells who, that back and forth is something that really is upsetting. From day one, and I have proof of this, I was that person that I contacted our administration, our mayor, and Dr. Prasad, and I have the messages from February and January that were basically very, oh, this is nothing, and proof of it. And so that's why I became really passionate at a very early stage. Council president now, we sat together with Dr. Baral and myself, and, we took this really serious. And throughout the months, we held meetings, and, there was a lot of going on. What I want to say is, we need to continue to have that open discussion, because I think that that's where, the city fails. The administration doesn't fully speak to us as a body, and we have to be told. I'm not going to praise Dr. Prasad. I don't think he's doing a good job. Not in my book, and I will never praise him. Now, I will say this. As an overall, we've had a lot of people working very, very hard in that department, in the Board of Health, the nurses, those individuals on the day in, day out. So again, I'm a direct person, and, I have not, unfortunately, been very happy the way things have transpired. But at the end of the day, I know that this is serious. I've always said it was serious. And, for those that have been affected, that have been on this council, some of them, it's affected you on a personal, right, your health, or you've known family. I know Councilwoman Mims, Dr. Mims, she's lost various members consecutively, back to back. So anybody that has been affected on a physical level or just on an emotional level can truly understand, that we know that this is serious. This is serious. This is not a joke. And I've never taken it as a joke. So when I hear comments of individuals, taking jabs, oh, people just don't want to quarantine, you got to really have the full conversation. So, with that said, my colleagues, it is important that we continue to support these measures. Madam Clerk, my vote is yes.
Thank you, Councilman. Councilman Jackson?
Thank you, Madam Clerk. Well, one thing I could truly say I respect, at least, is everyone is entitled to their opinion, but I completely respect Councilwoman Gallo's willingness to be straightforward, not validating or disqualifying her commentary. But the fact of the matter is, I want to, before we dismiss, I want to send a message to my council colleagues, because once again, some inaccurate information was given to this council. There is never a point in time where this council is an advise and consent council. The Faulkner Act empowers this council to have equal power. This is a mayor strong, council strong form of government. And the fact of the matter, anytime it's conceived or portrayed as the council being less than or less of, it does the community and this council a disservice. But the fact of the matter, the responsibility of that lies only on the council. And this council has yet to stand up and take its rightful place in being responsible, holding itself responsible as a body. Because one person can't do it. One person can't be the measure of accountability. It has to be consistent and it has to be across the board. I'll tell you this, what I have witnessed and experienced, the unwillingness of this administration to be inclusive, and everyone keeps saying it tonight. Council President has reiterated it multiple times this evening. There's a lack of inclusion of the council, so the administration basically is running rogue, making decisions that's detrimental to everyone at their leisure. But yet you can't tell me when this council has been responsible in standing up and putting forward measures to raise the level of accountability. In fact, I still want to know what came out of tonight's meeting. We met for a few hours to discuss some things, pontificate here, get some things off of our chests. It's more like a counseling session than a city council session. And the fact of the matter is, the council has the authority, the ability to equally transmit and transfer power for the city at its leisure, and it's directed by the president, and it comes through the council as a body. This council is never, when we stand in as a board of health, it is to allow the council an opportunity to hear directly from the health official, so that there is no discrepancies, that it cannot be misconveyed and or misinterpreted by the administration by giving off, because much like this council deals with when it comes to the DCA. We are often told so many different things by the administration, and we're told, well, it was mandated by the DCA, it was mandated by our monitors, and we never hear that directly. So what this process does in holding these meetings as a Board of Health, it allows the council to hear directly from the health advisor, health official, so there is no mixed messages. So that later on the council can't have a position of denial. That later on the council can't say, well, we didn't know that. When it comes to a detrimental condition of the overall health of the community. So with that being said, I remain steadfast. I remain, consistent in holding the administration accountable for the benefit of the community. It's not to be in opposition. It just so happens that I believe there's a lot of decisions that are made in detriment. One of the things that we didn't discuss, and I hope it's discussed in Finance Committee, is the financial gain by this third-party entity and being able to render services and being a partner of the community, and by the city reducing its number of days of testing. How does that impact the financial solvency of this third-party agency? Because these are things that we should be talking about, but we have not. But I'm not the finance chair, and nor am I the finance supposedly guru, but I'll tell you what, there's a lot of people who are benefiting financially on the city's condition, on this condition of COVID, and we have not yet to stand up and take our position. I wanted to make that known, and hopefully we can have a rebuttal from our corporation counsel relative to whether or not the city council, because anytime the council is standing in as a board of health, it still never takes the authority within the council, and the council is never an advise and consult board. It is an equal power yielding board for the benefit of the entire community. With that being said, Madam Clerk, I appreciate the opportunity. My vote is yes.
Thank you, Councilman. Councilman Khalid? It's not there. Councilman Mendez?
Thank you, Madam Clerk. And before my vote, I do believe that this was very productive meeting, just because we find out multiple choice to increase the testing through partnership through the county, but reducing the testing days from 6 days to 2 from the Board of Health, that is a big mistake, and it's very concerning to me. Especially, I've been following up the testings, different sites, especially in the Third Ward, Breland Avenue, 19th Avenue, by Broadway, River Street, and people are attending, they're getting tested, and especially now, this pandemic, our numbers are going up, and I truly don't understand why the administration, instead of saying, from 6 days to 2, why we don't call the county, why we don't do those phone calls, why we don't call those partners. That's the first step. And I'm hoping that we could get as a body the result of this meeting, the phone call that need to be done with the county, and how we're gonna bring the number of day out of testing site in Paterson. We gotta find a way. The money's out there. We gotta do the homework, but we gotta continue testing. And that's number one. Number two, one of the things that I want from this meeting is to see the Board of Health, Dr. Prasad. I would definitely would like to see your department directly involved with our partner. And let me say this, we have a great chief, our fire chief, and we all know that. We know his capacity. When the administration assigned him to do this, he stepped into the plate and he got it done. And I admire him for his job and his tenacity. But I totally understand, and I know that this is the health department responsibility to oversee those sites. I want to see that fixed. through this meeting. I don't know how the administration gonna see this, but I would like to see Dr. Prasad more involved in those partners, because we know that there's been problems with those partners. And they're making a lot of money in the back of our Patersonian, and they're not providing the service that they have to provide it. I'm just here advocating for my Patersonians. That's my job as a legislator. I get all the phone calls, all the complaints. I have to pass it to the administration, and I hope to see this resolved after this meeting. And with that being said, I think that we just gotta continue praying. I mean, 2020 was a very difficult year. We lost so many families and friends, but our number are just continue going up. So we have to be mindful of that. And this is not a joke. And I feel very concerned about the administration just taking the decision of just reducing testing days from 6 to 2 just because of funding, instead of making those phone calls, doing the homework to increase the time. And I'm just gonna say this, and I'll never forget about this, because I wasn't sitting here when this pandemic started. Paterson didn't have one testing site. It was all at the William Paterson University. Patersonian without transportation was very hard for them to get tested. Now we have enough. Now we have testing site. Let's just keep pushing to keep our health department out there in the street. My body's just fine. Good evening, Paterson.
Councilman Mims?
Yeah, so first of all, let me give my condolences out to our deputy clerk in the passing of her father on today. She has my deepest sympathy and my prayers for her and her family. Also, I want to give my condolences in the passing of Miss Ada Downing, who was a very strong pillar in our community. I've known her since Gilda and Amir days in the hair salon, but she was one of the leaders in the Delta sororities. Also, Mr. Carney Bragg, who years ago took me in after my dad died as a daughter. He will be missed. His funeral service will be this Saturday, I believe, from 10 or 11 in the morning, all throughout the day till the evening at Bragg's Funeral Home. So I want to put that on record. I want to, I think that's Councilman Jackson's phone that's not on.
Yeah, just mute it, yeah.
And of Principal Joe Clark. I know I share the same sentiments as Councilwoman Davila. We are alumni of Eastside High School. Principal Clark was very dear to everyone that was there. He cared for all of the students. When I came into Eastside after being at Paterson Catholic for 2 years, my dad had just passed away. And I never forget that Principal Joe Clark came to the funeral, and I was a new student at Eastside. I will never forget, the words, the advice, and all of the information that was provided to all of us, even if we were made to sing Fair Eastside over the intercom, whether we could sing or not. So our prayers go out to his family, to Hazel, his daughter, and to everyone that knew or had any connection with Principal Joe Clark. Our prayers go out to him, to everyone that have lost loved ones due to COVID, that are suffering due to COVID, that are going through so many things in our community because so many people are passing, not just from COVID, but from heart attacks and so many other things throughout the course of 2020. All of the shootings that are going on in our community. I'm praying for all of the families of all of those victims and the perpetrators, that the police will continue to work diligently to bring justice to that. But, as we're in this place, and I commend us having a meeting on tonight, Council President, and I think we should do this even more often, especially when it comes to situations like this where we're cutting testing sites and it does not match the recommendation from the health officer, and also when it does not match the inflated rate or number of positive cases and deaths that are going on in our community, and people that are in the hospital are suffering, and all the hard work that is being put in. I heard the great news alert about what we will try to do. I have some concerns with that because that means that our workers that are on the front line will get an increased capacity of work to take on this responsibility. They have not gotten hazard pay. They are continually on the front line, mostly overworked. Not sure if their pay is commensurate of the work that they do. So those are some things that when we're looking into this great news flash recommendation, we need to definitely take that into consideration, because if one person is out, it affects the entire department. So we have to make sure strategically that with this recommendation that all of those things are considered. I want to commend the employees of the city that have been on the front line since day one, from the very beginning, working on the front line, risking their lives. So many of our employees, some have been sick, in the hospital, still suffering, and sometimes we just have to tell them that we appreciate the hard work that they do. So once again, Council President, I don't want to belabor the point, but tonight I think was a good meeting. On tonight, and there's more information. I'll bring it up on January 12th, which is next Tuesday. I'll bring it up at the meeting when we have those items on the agenda. But to the VA and to Dr. Prasad and Director O'Sheen, the information that I requested, please respond back to that and make sure before you make any of these decisions that we take those points into consideration, because we can't just, even though we're increasing testing sites, if the influx of the rate is in certain particular areas, we should be focusing there, because if we go to the root of it, we can stop the spread across the city. So let's take those recommendations into consideration. If we're truly about saying that we really want to work cohesively together, these are recommendations not to be given by the council and then not to be ignored. If we're going to work together, please take the recommendations and hear the heart of the council members as they cry out to you for the needs, because we hear them every day from the residents of this city. So Madam Clerk, my vote is yes. And I pray for you too as well, Madam Clerk, feel better.
Thank you. Mr. President?
So I want to thank my colleagues, and I want to thank my colleagues for actually being part of a meeting that actually was under control, and I think it was very positive the way it was ran. I would thank the administration for answering the questions to the point. And that's what we expect in every meeting. I just want to reiterate that the council cannot direct staff. Right? We might be equal in power as a body with the mayor, but you have to read your Faulkner Act. We cannot. That's why, it is good. It is good to be vocal but it's okay to be opinionated. But when you're misinforming the public, I don't appreciate that. I don't appreciate that at all. It is often said, the president. All the president does is control the agenda. So, some of my colleagues have given me the status like I'm right here with the mayor when it comes to power. No, as a body, we're equal as a body with the mayor, but with some limitations. You know why this council is not doing a better job? And we're doing a good job, but we could do a better job. You know why? Some of my colleagues don't take the time to understand what is being presented to them. I'll give you an example. You recall the time that the city did not have any roads being paved in the capital plan? Where was the council back then telling the mayor, you're submitting this plan of services, for us to approve, to provide the services to the communities. Where's the road resurfacing plan? Now the council members from the wards, where were you to say, well, I have a lot of bad roads. How come you don't have any here in your capital plan, right? Same thing with the budget. We're complaining all the time. Yes, we could hold the administration accountable to an extent when it comes to, approving their plan, which is the budget and the capital plan and a lot of other things. But to put the fault of things that go on, and some things that even out of the control of the administration and the council, it's just things that happen, sometimes it's due to the economy, but a council member passed a comment pertaining to finance. How a third party financial gain have anything to do with what we do here. They're providing a service that we're not providing. That service that they're providing is not affecting our taxpayers at all. We're not here. We don't provide testing so we can make money. That's not, we're not in the business of making money, believe it or not. That's not what we're here for. That's why a budget is very simple. For every dollar that you are planning to spend, you have a dollar of coming in. We're not here to make a profit. So, once again, let's stop misinforming the public. The gentleman that took the jab and said, oh, I hope we discussed that in finance, which was Councilman Jackson. We hold about 4 meetings a month. In the last 6 months, we had approximately 24 meetings. Councilman Jackson, if you were so interested in the finances of the city, I think, and the public would agree, you would have been there more than 2 times. And I hope my council colleagues that are in the finance committee correct me if I'm wrong. Because maybe I was out one day out of the 24 meetings, and maybe he was there. But I think it was around 2 times that this person was present. So if you don't understand, how government works, I would appreciate if, I'm not going to silence anyone. You can say whatever you want. But I just want the public to know that it's important that you know where the comments are coming from. That's why the city's not in a better situation, because there's no check and balance. In order to have check and balance, you need to know what is being presented to you. And some colleagues don't know what is being presented to them. A good example, body cameras. For many years, council members were like, we need body cameras, we need body cameras. The chief would say, oh, we don't have the money. And nobody would recommend anything. 2 years ago when I came in, oh, we don't have the money. Okay, let's put it in the capital plan. That's not an excuse. We need body cameras. The money's been there for over a year. We're getting them done. I saw a press conference today. The money's been there since 2 years ago. We're just getting them done now, but the resources were in place. You want an effective government? Let's do the work and let's stop complaining. Let's work with the administration. When they do wrong, we do what we do. We let them know it. We let them have it. But you know what? I'm here to work with the administration until you screw up. Once you mess up, I'm going after you like I normally do. I'm not going to change my ways. But to Councilman Jackson, keep reading those bylaws and I hope something positive come out of them. My vote is yes. Madam Clerk, I wish I could give, I know we closed the meeting, but Dr. Paul wanted to respond. Is that possible, Madam Clerk? I just didn't want to do it during roll call. Before you call the vote, could you let Dr. Paul, I want to let Dr. Paul respond to the.
I thought once you did the vote, he can't respond. That's what I thought.
She didn't call the vote.
You was the last vote. I thought it was over. It's over.
She didn't call the vote though.
I didn't call the vote. You was the last person.
All right, let's hear from Madam Clerk.
I didn't know
Hold on a minute. We're gonna ask Madam Clerk. If not, we're gonna have it.
Council President, we only closed the health meeting. We still have a council meeting to close.
What are you talking about?
This is the meeting.
This is the meeting.
It was just a special meeting, Councilman.
All right. So, Madam Clerk, can you clarify? Madam Clerk, can you clarify the law?
Yeah, I think,
Either way, it's fine. I just wanted to do the
I
right
think
thing.
Dr. Paul can speak and then I can announce the vote.
Thank you.
Yeah.
All right, Dr. Paul.
Any formal action, it was just a discussion.
Any closing remarks, Dr. Paul? We can't hear you. We came to hear from you. So you have, we told you our concerns, right? I just want you to let us know, what we're gonna do going forward, or whatever you want to add to this meeting before we close.
Okay, in closing, I commit to work for the city of Paterson. I've done throughout this pandemic and long before this pandemic. I'll continue to do that to the best of my ability. As you can see, for a few days I've been working with LabCorp to absorb the billing. I couldn't get an answer. I had some back and forth in certain areas. This afternoon, not so long ago, I was able to confirm with LabCorp that they will do the billing for the uninsured. So I think, I would always try to do my best for the city. I live in the city, and this comes from my heart. I do not care about praises from anyone. I really do not. I don't care about praise from any council person, I do not care for praises from anyone. Now, I can tell you something that Councilwoman Marissa David has used this forum and social media to bash me. Now, she has done so
Council President, I think he's out of line, and I don't think he should do that because not only is he out of line by addressing me, okay? He's done it on social media as well. I have the screenshots of all the things he said. I think he needs to stop.
So Dr. Paul.
I need to respond because Councilwoman, I need to respond because Councilwoman, I think she's trying to buffle me and trying to gag me, and she cannot.
Council President.
Dr. Paul,
I deserve to say,
Dr. Paul, we had a positive meeting.
I understand, but you know what?
Council President, he cannot do that, you know that. You know he cannot do that, Council President.
But you're not helping, let me, hold on, Dr. Paul.
I'm addressing you, Council President, not him.
No, I know, but what I'm saying by not helping is, I'm trying to cut him off, but you're cutting me off. So I cannot cut him off because you're cutting me off. So, Dr. Prasad, you know, closing remarks about the meeting, I gave you the courtesy. The intent was not for you to go after, a council.
I'm not going after Council President. I'm not, I just need to state a few points.
Okay.
Council President, you cannot address anything pertaining, no.
So, Dr. Prasad, please, finalize your comments, please.
I would like the law director to tell me whether I can make some comments or not. I'm requesting, if Corporation Council is there, to allow me to make some comments, because I'm tired of
a city employee to
Listen, Councilwoman, I cannot read people's mind. If I could read people's mind and people's action, we would not make a lot of the mistakes we make.
But you can, the same way you can turn off his mic, okay, and you can ask Corporation Council, he should not be addressing that.
So hold on a minute. So Ryan could tell you that in order for me to do that, I will have to click a few buttons. Then I put that install that feature. It was no need during this meeting. Okay. And it was a very organized meeting. I didn't have the need to block anyone.
Council President, I think this is going off the tracks.
It is.
The border.
It is.
We're not going to discuss.
Well, this was, Councilman.
To bring it back on track. So,
Councilman, this was.
I'm going to call point of order. It's the middle of a roll call. There is no discussion in the middle of a roll call.
Councilman.
Therefore, we should vote and conclude the meeting.
Councilman, this was unexpected. It was just to wrap it up. This meeting was between us to hear from him. I wanted to just hear what he wanted to say. I didn't know he was gonna go that way. So, Dr. Paul, if you don't have anything to add pertaining to the requests that we have and the things you need to look into, I don't think it will be beneficial to this meeting. It doesn't make a point. It's not beneficial to the purpose of this meeting.
I still request the Corporation Council to decide if I have a say or not, because
we're not gonna entertain. Dr. Prasad, you could call Dr. Prasad, you could call next meeting. You have 3 minutes to call in during the public section, during the public portion, and you can say whatever you want. You're a resident, and anyone, even non-residents, can come to the meeting and they have 3 minutes. So if you want to address any particular council person, in the manner that you did, any concerns, if what you're about to say don't have nothing to do with the meeting we had today, I just don't see the benefit to going back and forth with a council member at this time. So let's just close the meeting. Madam Clerk.
Mr. President, the vote is 7 in favor, 2 absent. The special meeting of January 5th, 2021 is hereby adjourned. Good night, everyone.
Good night, everyone. Thank you.
You're welcome.
Thank you, Council President.
Good night, everyone.
Good night.
Good night.
All right.
Thank you.
Good night.